This Board of Health meeting is called to order. Madam Clerk.
In accordance with the Open Public Meeting Act of the State of New Jersey, adequate notice of this annual meeting of the Franklin Township Board of Health was made as required, indicating that this annual meeting would take place at the Municipal Building at 6 p.m. on Tuesday, June 25th, 2024.
If we could all stand for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America, republic for which it's okay, it's all yours.
No, roll call. Hold on.
Oh. For those watching, I have no script here, so I'm winging it.
You're right, Mayor. You don't have clerk.
So, Madam Clerk, call the roll, please.
Councilman Embarrasson?
Here.
Councilwoman Francois? Councilman Karazi?
Here.
Mayor Kramer?
Here.
Councilman Onijaka? Deputy Mayor Potasnik? Councilwoman Udine?
Here.
Councilman Vasanella?
Here.
Councilman Wright?
Thank you.
Okay. Good evening, everyone. Mayor and Council, thank you for allowing us to be here.
Got to get right into that.
Got to get right into it. Okay. All right, I'll try to be loud in case this doesn't pick me up. So, again, thank you for being here. My name is Mike McCarty. I'm the Deputy Director for the Somerset County Department of Health. I'm just going to give, and some of you may remember me from last year, I'm going to give a brief overview of the department, what Somerset County Department of Health was up to over the last year in 2023, and specifically what we were doing for Franklin Township. So these are our 8 main program areas, and by the way, I don't like narrating off of PowerPoint slides, so if you have any questions at any point, please feel free to raise your hand, stop me if you have any questions or want clarification. These are our 8 main program areas. Really, it should be 9, but consumer health, that's your health health inspectors doing your pools, restaurants, retail foods, all that good stuff. Health education and promotion, chronic disease and cancer prevention, those are linked together. We have the County Environmental Health Act under our department. That's the DEP representatives. They're doing your air, noise, water pollution, things like that. We have our epidemiology and our nursing division. We have our FEP team that is, deals with emergency preparedness, our Medical Reserve Corps, and our Childhood Lead Poisoning and Prevention team. There really should be a 9th for administration, but I digress. This is our team. This is basically the same list of people that was at the department last year. We do have a couple changes, a couple promotions. Unfortunately, Patty Elliott, who many of you probably know, she did about 40 years in public health, retired in December. Fortunately for us, I do have Rashida Boyna behind me. She took over for Patty. Rashida's been with us since January now. And Rashida and I started together about 10 years ago, so we were very happy that we were able to convince her to come back. Other than that, Dr. Terry Clancy is the health officer for the department. I'm the deputy director for the department, and this is kind of the structure for the rest of the department. Whoops. So again, I don't want to bore anyone with raw data and details, but this is basically what Rashida's group has been doing since 2023. These are the numbers. You can feel free to read these, and if you have any questions. Otherwise, I'll just narrate basically what we're doing. Retail food pre-operational inspections before an establishment is approved to open. That comes through our office. After it goes through your zoning office and your processes. Temporary retail foods, so we're doing your events, going out to the Franklin Days and things like that. Mobile foods, Franklin, we also do the reoccupancy inspections for all the apartments upon turnover of tenants. We do septic system installations and investigations in town, child daycares, rec bathing facilities, and well abandonments. So these are the breakdown of the complaints that we received for Franklin Township exclusively last year. 41 retail food complaints, 67 garbage and debris, and so on. So, yep, Rashida's group and previously Patty's group has been very busy with these. So this is the health education section. So Stacy Toolin is the program coordinator for the health education program. So basically these are people that are tasked with making health education materials, our press releases, doing community outreach, things like that. And so I'll talk a little bit more about that because we've been doing a lot of novel things that we haven't really been able to do in the past before. So like I said, this is a group that does the creation of health ed materials, press releases, we do community outreach, food handlers training. So before anyone can serve food in your restaurants, they either have to be Serve Safe certified or a Learn to Serve certified. They have to have some level of certification that proves that they know what they're doing before they're handling food product. We partnered with Healthier Somerset. That is as part of the Community Health Improvement Plan process and the Community Health Needs Assessment process. I'll talk a little bit more about our own internal process that we're running in a little bit. As part of the health education and program team, we also have the chronic disease self-management program. That individual is Katie Stewart. She's tasked with effectively just dealing with chronic disease, mostly cancer, breast cancer, things like that. They also do our website management and our social media creation. So in 2023, these were a couple of the things that we were able to do through our health education team. And this is stuff that we were really excited about because the phrase that comes to mind is never let a good crisis go to waste. Everything that's on this list is paid for by grant funding, which we previously have not had. So we were excited. We were able to do a TV advertisement last year. We were able to advertise in the mall and just doing general health ed topics like, washing your hands, staying home when you're sick, things like that. We also had a couple geo-mapping campaigns, and this is something that's really cool. It's also a little bit expensive, but again, we use grant funding for this. The geo-mapping campaign, if we had, for instance, we had a little mini outbreak, we'll call it, of monkeypox. So what we did is we worked with the company that we had previously worked with, and we said, this is how many clicks we want. We want to target this area and this population of people, and they'll set it up so that they get an ad on their phone, and they say, hey, if this is something that interests you, please talk to your primary care physician and consider being vaccinated. And we also had the billboard on Route 287, which is something we've had in the past before, but it's something that we can continue doing as long as we have the grant funding to do it. I previously mentioned our RCDC, the Regional Chronic Disease Coalition. We are partnered, I don't know how this ever happened, but we are partnered with Morris County as it stands presently. And basically what that is we have to run programming. So you'll see here in this little corner, we have Cancer Thriving and Surviving. That's a program that we offer a couple times a year. I believe there was also a program that we ran. I have to check. I think it was Franklin. It was in September of last year. And I believe that was the Chronic Disease Self-Management Program, which was at the Senior Center. And I believe we're going to be doing that again this year, just because we got a full turnout with that last year. I had mentioned previously that we also have the CHA department. That's our county environmental health folks. They work hand in hand with the New Jersey Department of Environmental Protection. Every county health department has them, situated within the health department. So this is a breakdown of the activities for Franklin Township last year. 158 total actions, I'll call them. A lot of those are Public Record Act requests. But you'll see that there's some solid waste complaints, complaints referred from NJDEP, air emissions, and safe drinking water. So what Erin and her group have been doing pretty well, actually, is we've been incorporating GIS into a lot of the functions that they're doing on their side, so you can get an actual visual representation of where issues in your town are happening. Somerset County on the whole is expanding GIS services to do a lot of cool things. They gave us a presentation last week, so if I want to see cancer screening rates in Franklin and I want to break it down by ward, they've promised me that they'll be able to do that. And things like that. If I wanted to see non-English speaking within a municipality, they can do things like that. So we are expanding that at the county level as well. Our epidemiology, nursing, and disease prevention program, this is the ultimate goal of the program, is to reduce the spread of communicable diseases in the community through timely investigations and contact tracing in Somerset County. So this is a very wordy slide. I didn't put this one together, so don't blame me. But basically what this goes through is a little bit of the program highlights that the nursing division has to maintain and do every year. One of the big ones is the child immunization audits. So you'll see on the third bullet point down, our nurses have to go out to every school, daycare, under the sanitary code, and we have to check the students' immunization status to make sure that they don't have to be excluded from the classroom. This is just a breakdown of the communicable diseases that were reported in Franklin Township. You'll see the blue bars.
Could you, excuse me?
Yep.
This is a compliment. Could you go a little slower?
Oh, absolutely. Yeah, absolutely. So you'll see that.
We just, by the way, we just, I guess those who got opened their email might have seen it today, but I don't think any of us ever saw this report, so.
Absolutely.
For me, it's important. I want to.
Sure, sure. If you have any questions, like I said, please feel free to stop me. I do not mind whatsoever.
I missed it, but I'm just jotting questions. We'll wait until
Sure.
if you can go a little slower. Thank
sure.
you.
So you'll see this, this blue bar here is by and large still the majority of communicable diseases that were in Franklin Township last year were still COVID. In our Board of Health reports that we provide to the board, you as the Board of Health and the Advisory Board, gives a breakdown of the other top 3 or so is what we kind of found as the sweet spot, or at least that's what we think is the sweet spot of other prevalent diseases that we had per month in the municipality. Again, this is just another breakdown showing the top 5 communicable diseases that we identified in Franklin last year in 2023. Overwhelmingly, like I mentioned, COVID-19, Lyme disease second, hepatitis C was third, hepatitis B fourth, and babesiosis was last. Another part of our nursing team, a little bit off on their own in a little bit of an island, but still part of the nursing group is our childhood-led team. We have one dedicated full-time nurse case manager who does all of our follow-up for any environmentally or elevated blood level child that we identify. So you'll see we put this blue bar, this blue box around Franklin Township just to give you an overall representation. So while it does look to be the second largest municipality that we have that has that level of elevated blood level children, I think given the population, because these are just raw totals, given the population in Franklin Township, that's actually pretty good. You'll see North Plainfield Borough is by far our worst offender at this, is just because of the housing stock in North Plainfield. A lot of the housing stock in Franklin Township, the apartment complexes are either built post-1978 or they have lead-safe or lead-free certifications. So usually if there is an issue in Franklin Township, it's usually we found cultural, food, cosmetics, things of that nature.
Excuse me, we're the second largest?
Yeah, as you can see here, so this is
No, on the bar graph,
On the bar
Mayor,
graph.
not
Oh,
the
okay.
township.
Yep.
Okay.
On the
Yeah,
bar graph.
On the bar graph, yeah. Yeah, the raw totals are actually very low for Franklin Township. I think last year was about 20 cases that were confirmed elevated blood level children. So given your population, that's actually probably really good.
By population, we are the equivalent to all of the other towns combined.
Right. Okay.
So I had mentioned a little bit before that this is just basically a little overview of the other side of our nursing units. So they will conduct the immunization and the well visits and the exams for children. So this is a breakdown of them. You'll see that the flu shots administered was provided by our department. Some of these statistics are because, for instance, the HIV testing, we actually contract that out with Zufall as our FQHC in the county. What I will mention in a little bit, just towards the end of the presentation, is how we're trying to bridge that gap. We've had some, we'll call it community feedback, stating that we haven't really been. There's definitely a gap between services between what Somerset County Department of Health can offer and what Zufall as the FQHC can offer. Another breakdown, more numbers on the chart here. We also contract with a company called ID Care. They are the ones that maintain our tuberculosis clinic. That clinic is situated within Robert Wood Johnson Medical Center. So these are the raw totals for TB cases in Somerset County last year. This is a little bit about our FEP team, as I call it, the Public Health Emergency Preparedness and Response Team. Their ultimate goal here is to provide public health emergency preparedness response plans updates messages on a countywide basis daily. So if any of you are subscribed to our Links messaging system, you should be getting these alerts. They come out daily, if not, sometimes several times a day, with things like cosmetic recalls, foodborne illnesses. It's just generally good information to have. So if you're not subscribed to that and you would like to subscribe to that, please let me know, and I'd be happy to put your email on the list. We do have our links coordinator in the department maintains that list.
Sir?
Yep.
Quick question
Sure.
before I forget. Do you have various settings? I notice on there if someone signs up, they're going to maybe get hundreds of messages. Do you have to where they can get a certain type of messages like they do with alerts on cell phones?
Yes. There is a way. There's a way that we can do that internally, that we can
Well,
break
that's
down your
available to a person that may want to sign up for certain type of...
Yes, you can break it down so you're not getting every, you're getting class 1 recalls, which means that the health department has to go out. You're not getting.
So that's available for the sign-in process for the public. They'll be given options?
Yeah, it's a little bit convoluted, the process now. You still have
Well, you don't have to get deep into it now. I
Yes.
just wanted to, okay.
There is, though.
If
Yep.
there's time permitting, you can elaborate or get back to me another time. Thank
Yes.
you.
So a little bit more about our emergency response for 2013, or 2023, wow, I'm going way too far back now. This is the amount of COVID vaccinations we administered, how many test kits we administered, our homebound vaccinations, how many we did last year. We did some exercises with our FEP team and our Medical Reserve Corps team, as well as some other response plan updates. So Somerset County Medical Reserve Corps, we're really trying to rebuild this. We're fortunate enough, we just hired a new Medical Reserve Corps for the county, and he's basically dedicated to doing just Medical Reserve Corps and the links coordination for the Somerset County. So we're excited to have him on board and really try to make this a more robust unit. Basically, we have a network of medical professionals, and it doesn't even have to necessarily be medical professionals. We have some administrative people that are in the Corps as well. So we're always looking for new volunteers, and we are trying to do a little bit more programming with them. We did a Stop the Bleed kit, or a Stop the Bleed training with them last year. We did an Autism Shield training with MRC last year. So we're always looking for ways to keep our members engaged. A little bit more about the childhood lead prevention poisoning. I'd mentioned already the raw totals before, but this is the goal. I'm not going to read the whole thing to you, but basically the whole goal of the CLEP project, as we call it, is to reduce and eliminate the risk of children becoming lead burdened and poisoned. We follow children up to 72 months, but the code is a little bit weird in that if we have someone that is consistent and persistent, we can follow them actually up until they're age 17. So sometimes these cases can last a very, very long time. I believe this is Franklin specific. So when there's an elevated blood level child, there's a two-part thing. There's the environmental. That's where we will go out with trained inspectors. They will use an XRF, X-ray fluorescence. They will check walls, floors, windowsills to make sure it's not something that's a hazard in the house. We also have our nurse case manager who will go out and provide a lot of education, nutrition, and just general health ed topics on how they can manage the lead level for the child. So we've actually made this program a little bit more robust. We've been trying to, as it mentions in the bottom, we've been distributing water filters and just cleaning kits for people. We've had a lot of people mention to us that they've been very appreciative of getting these kits because they don't necessarily have these expensive water filters or these mops and kits that they can use for cleaning supplies. So we've definitely had some success on that front. This is an overall screenings. So these totals look a little bit gaudy in my opinion, but these are all screenings done by pediatricians, doctors' offices, hospitals, us. So Franklin Township, about as many as last year, had about 748 children that were reported that were screened for lead in 2023. So that is basically the end of the presentation. So I just want to give an update. I know this isn't 2023, but just a quick update on where we are and where we're going as a department. We have a meeting and we have a site visit next week to go over our new Vaccines for Children clinic space. That's something that we've wanted for a long time, but basically what we've heard is that there's a lag time, a wait time for Sioux Falls to get a lot of these uninsured and underinsured children vaccinated so that they can go back to school. Because if they don't have their vaccination series and they don't have a religious exemption, we are forced by law to make sure that those children are excluded from the classrooms. So we have a space. It is at Richard Hall. What we're planning on doing is gauging the demand for that in the early going and seeing if we need to make that a one a day, once a week type thing, a twice a week type thing. We're excited about that because Somerset County Transportation will run to that clinic space. So people that don't have transportation in Bound Brook or Franklin can still get to this clinic space, get their children vaccinated. We'll do screenings there, we'll do well visits there, so we're looking to make that a little bit more robust. So by the end of summer, we're hoping to have our temporary space set up there. We're also going to be procuring through grant funding an electronic health record, an electronic medical record system, so that we'll be able to do appointments and track all that, track all those children. I've mentioned this ad nauseum probably over the last couple of years. We're working through our public health accreditation process. That process is probably about midway through. We are applying in October of this year. Basically what that does is that just has us we're measured against a national standard. There's only one other county in New Jersey that I know of that has already received this accreditation. I believe that's Camden County. But we're looking to do that just so that we make sure that we're not missing any gaps and seeing where we can effectively deliver better services. Lastly, we are doing our health database is due for an overhaul. So we have our new vendor, Rashida, and her group have been great working through that process. So basically, that'll be just joining the 21st century. People will be able to log complaints in online. They'll be able to visit our online portal, and they'll be able to see real-time inspection reports if they want to go out and go to a restaurant and say, hey, I'm not going to eat here now because I've seen this inspection report. So those are our three or four big projects that we're working on right now. Other than that, I'd love to take any questions you guys might have.
Vassanello?
I'll give you a few of my top questions, and the others have a chance. Not to harp on it, but I don't know when this information is available from 23. Is there a way we can get a report, even if it's a draft report, more than pretty much at this meeting?
Absolutely. Yeah, and I apologize if that's not already happening, because we usually give all of our boards of health a year-end report that just summarizes all the stats. So if you haven't been getting that, that's on us, and I apologize for that, because all of our boards.
And also whatever you're presenting today, because some of these questions I probably could have found out on my own or emailed separately, and anyway.
Sure.
A couple of quick things. Food handling, I notice you do it virtual. For what it's worth, I don't think that's effective. I think food handling is still one of the biggest issues. Not saying we're any worse than anywhere else. I go in places and just politely kind of walk out because having some knowledge to see what's going on. Love our restaurants in town. But I still think that's a big issue nowadays, especially with the transiency of employees or the lack of training that I keep hearing from friends I know in the restaurant business. So I really think that should be focused and should be in person. I'm wondering if you do any kind of follow-up. I don't mean investigate, but is there any real field applications to approaches to going out and seeing if the people you just taught are doing it? Or, what do you do? Like if a place gets violations for that specifically, what is the follow-up? I know there's other things with food handling, food restaurants, but to me, that's one of the most critical. So if you could elaborate on that, and then let me just throw out something else to try to consolidate this. The other big thing I had concern, or two issues, the fines. Is there a way that the part that is public information, and I'm sorry I'm going so fast, but I know we have little time, can someone go and click on, and if they can't, can you see if that's something you could do for our town, that they can click on that map you had, assuming it's public information, and find out exactly what the violation was, what the resolution was, et cetera. I think it's important to our people who are interested in this, in that stuff, people who have asked me about it before. And then the other thing, the lead, as you probably know, there's new ordinances in the state, statutes that now towns are adopting. I hope we don't get a lot of lead, bad lead reports, but with the new law that rental properties have to go through a lead inspection process, do you have a way that you follow up if one of those comes back, because I don't think that's derived from the health department, if one of those comes back as positive, do you have a system set up to where then you can go and make your services available or track or whatever you do with lead to anybody who may have a concern? So if you can, sorry to throw it all at you, but if you could address those.
Let's back up to the your first question, which I wholeheartedly agree with regarding the ServSafe being in person. That's something that we did right up until COVID, and I'm not going to blame COVID because we do that all the time.
Yeah.
Yep, we're way past that. So what we did is, to bridge that gap at the time, we decided that we were still going to offer the program, but we were going to do it in a virtual setting through ServSafe, which is nationally accredited. It's a very good program. It's the most popular one. It's basically calling a tissue Kleenex is ServSafe. But we have been talking about reinstituting maybe twice a year in person, and that's basically, we were doing it quarterly, the food handlers training. So we're talking about doing that at least, twice a year, having those back in person, and because a lot of people do learn better that way. So that's something that we've been talking about, but only to the level of basic food handling. So if anyone needs a food handler or food manager training, they're still going to need to go through one of the national outlets for that. But to your second point to that question, I don't really think so. Rashida can correct me if I'm wrong here. When someone gets the certification through us, we don't usually go back out and check that. Now, we are doing our, our due diligence, and we're doing all of our retail food inspections. Basically, how those work is if you have, I call it 3 critical violations in an inspection, you're automatically ruled out of person in charge maintains knowledge. So that's one check that we have in place, but we don't go and revoke your training or anything like that once you receive it.
Retrain?
I don't think there's an avenue for retraining.
There's no avenue to retrain if places in violation of food handling issues?
Not that I'm aware of.
Not an issue, we can move on.
Yeah.
I'm amazed, but okay.
Yeah. Do you think we can, you know what, I'm going to get back to you on that, just to make sure I'm not speaking out of...
So if there's not retraining, then they just have to take the entire course over again.
Yeah.
So that's the recourse, Jim. It's not that there's no retraining. They have to take the entire course again and pass it to be permitted to handle food.
Definitely if they failed it.
Right.
No, but I mean, if you go in and there's an issue, violation for that,
Yeah.
you retrain that person or the whole thing, or they're...
It's difficult because, that person might not even necessarily be on site that day.
Right. That's what I'm kind of
yeah.
getting at. It could be systemic to where it just needs a little reinforcement, but whatever, we can maybe communicate,
Sure.
or whatever the proper protocol. I just would love to see that, enhanced to be the best possible for our town, that's all.
Yep. You had mentioned and I think I missed one in between there.
And the environmental, resolve
Yes,
environmental
yes.
complaints readily available to the
Yep.
public.
There's parts of it that will be readily available. What you're seeing there with the GIS will be readily available, but specifics about it, the actual address, the name of the property owner, that's still going to be public record, but that's still something that they're going to have to request through the OPRA, FOIA process. We only release certain bits of information.
But they'll be able to go and tap on the map and see, so whatever Acme Corporation got a fine for polluting the water resolved
It'll
on
show
blah,
what
blah
type.
date.
Yep.
Okay.
You'll see at least that part.
Great.
As far as the lead part, so this
Yeah, all
gray
the new
bar-
lead
Yep.
stuff, how that,
The gray bar here actually shows less than 5 micrograms per deciliter of blood, and the reason that we thought that we should show that on the chart is because the new law will be changing to dropping that to 3.5 micrograms per deciliter of blood. So we're expecting across the board, across all of our municipalities, to have higher raw totals unfortunately, of children that are, poisoned. What we did proactively last year is we identified all those children that are in those gray bars, and we sent out education materials to the families, the parents, the guardians, to let them know that, hey, technically your child's not a case right now and there's not a lot we can do for you. Here's some education materials for how you can try and bring that level down. New Jersey's completely backwards, in my opinion, in the way that we treat environmental inspections because we are not allowed to go out unless the child is poisoned on the environmental side.
Are you allowed to contact, real quick, I think this was the last item, that if, with all the new statutes, when things come back, if they come back with a too high lead volume, that's not coming out of health department, is there a mechanism that you guys communicate? Like you're automatically notified if the rental unit is above the levels, so you could reach out
Yeah,
for?
not automatically. This is still very much a learning process.
And it's brand new. Is that something you could look at, whether it's through our manager or the county administrator, to see if there's a way that that could just be like a setup as an automatic thing? I would think that the health department would want to at least provide information and know if there's rental units that are above the levels and failed their health
So,
tests.
Councilman, I believe that the requirement of the testing company that will be providing the testing is if there's a unit that was built and required to be tested that was built prior to 1978, that they're required to report to the State Department of Health, not the County Department of Health, the State Department of Health.
And so that's absolutely correct in my understanding as well. So what's been happening is I've been seeing, and this is again anecdotal, is some of our construction departments, Franklin being one of them, North Plainfield being one of them, they've had their designees reaching out and just saying, hey, just so you know, we had an elevated dust wipe floor sample that came back elevated. So, you know, we can be on the lookout for that just to send them health education materials, even though they're not technically a case.
Thank you very much.
Sure.
Anyone else? Those of you just turning in, this is the Board of Health meeting. Township Council is the Board of Health. We have a meeting once a year. Okay, so I skipped over a few items because I didn't have an agenda in front of me. Now I do. Going back to item number 4, approval of the minutes. Board of Health annual meeting of June 13th, 2023. Do we have a motion on the minutes?
So moved.
Moved and seconded. Any comments or changes? Madam Clerk?
Councilman Harrison?
Yes.
Councilwoman Francois?
Abstain, I wasn't here.
Councilman Karazi?
Yes.
Mayor Kramer?
Yes.
Councilman Oni Jaka? Deputy Mayor Potasnik?
Yes.
Councilwoman Udine? Yes. Councilman Vasanella?
Yes.
So,
I wasn't here last year, so I can remove, you can remove that, yes.
Move that to an abstention?
Technically, you, according to Robert's rules, you can vote on minutes that you weren't there for. You're just accepting them. You're not
He's correct.
voting on their validity or accuracy.
Yeah, you're right. Technically, you can. So we usually abstain, but
Yeah.
we got
The
that
vote
cleared up.
passed.
The vote.
who would have believed?
Because like, what if the whole body changes? Then you can never accept the minutes from one meeting to the next. That wouldn't work, make sense.
Who would have believed? Okay. Item number 5, Advisory Board of Health. Do you have a presentation?
Thank you, guys.
Thank you.
Can I have one question of Michael first before we move on to the
I
next
asked if
item?
anyone had any.
I understand, but then you jumped before you gave me a chance to say anything into your agenda. So this
gonna have a
morning, links went out regarding cooling towers and Legionnaire's disease. And the question was posed to me, are we distributing that to potential, if you read the letter, it comes from the New Jersey Department of Health, and it says in that letter, dear business owner, you are receiving this letter because you may have this type of device that needs to have attention paid to it
Right.
when it's hot, right? I'm obviously very much paraphrasing. So the question was posed to me, do we have a list of buildings that might fall into this category? And my one-word answer was no. When I further looked at the links notice, obviously this comes from the State Department of Health, and in that, it encourages local health departments to distribute that document to the facilities in their jurisdiction. So now my question is to you, and I think I already know the answer, does the Somerset County Department of Health have a database of those buildings that would fall into that category in the municipalities that they serve?
unfortunately, I'm leaning no. To
Your
this
one-word answer is going to be no, yes, and I understand that. But I question whether or not there is something at the state level. I mean, because I went to the Department of Health website, not you, but the state, after I got this email, and looked into what it is that they have about Legionnaire's disease and notices and things to do, and it talks about schools and hotels and all of the things that might have that type of HVAC system that's susceptible to that. I don't know how we would begin to prepare a database. We have a whole lot of buildings in this town that fall into that category.
So I'm wondering if our fire inspectors, would that be
Well, I
appropriate?
know, because the fire inspectors just simply, I mean, I can provide for you a database of buildings, but I think that it would just be that. It would be the entire list of buildings, commercial buildings, schools, and all that. I mean, they do fire inspections, right? I mean, I don't know, a cooling tower could be present at a warehouse, right? I don't know. I'm not knowledgeable enough on HVAC systems to understand that. And you're asking me those questions because you're the one that sent me the email. But I bring that up because these are the types of things that I don't know how to. I mean, I think what needs to happen is, this obviously went out and it's distributed by you.
Right.
This came out of Somerset County. So I think that for things like this, the county health department needs to look at the municipalities that it serves and ask the question that the mayor just asked me this morning. Do you have a list of this, or can you put together a list for whatever? This is one example. There might be 100 other examples.
Right.
I don't know what, when it comes to things like communicable diseases like Legionnaire's, right? That's, so I just bring that up because, I mean, it's sort of like a rhetorical question, but nonetheless, a
great
question
point.
that got asked to me, and I figured it was kind of timely.
So I'm going to do some digging on that tomorrow because, yeah, I wholeheartedly agree, and I think that's a great point. So while I don't have an answer for you tonight, maybe I have something more concrete tomorrow, hopefully, fingers crossed.
You know how to find me.
Appreciate it.
And if we did have any questions for follow-up, because I know we got, obviously, our council meeting coming up, what is the proper protocol? Manager may know better than you, so whoever, that if we have a question, do we just email, or should we email our manager, or email you, or?
Come directly to me, that's fine, whatever way, whatever.
Bob, is that,
Whatever way you.
like, if I wanted to follow up on a couple of
So,
things I mentioned?
as you
what's proper?
know, Councilman, what you are getting around to is the employee council relationship.
what would you like
They're
us to
not
do?
our employees. They're our contract, and you have every right to reach out to Mike or his boss or anyone else at the health department and ask questions. I mean, there's no reason why you can't do that.
Okay.
I think that for continuity, and I would ask that you include me if it's an email.
Which, I
so at least
usually
I
try.
know that you've asked the question, so that when you say to me, a month later, hey, I emailed the health department and they never answered me, at least I'll know that you emailed the health
I got
department,
you.
and I would.
I don't think that's going to happen, but I understand exactly what you're saying.
I don't either, but.
Okay,
Okay, we're going to move on.
I'm good, thank you. Thank you, Mayor. Some good stuff, and thank you, it's a lot of good info.
Are you good, Donna, with that? Right. Mike, you want to jump in on your computer? We're reading your emails.
Oh, that's okay, I got nothing to hide.
Could Oprah them anyway.
There you go. If my computer blows up. Yeah, yeah.
Dun, dun, dun.
Thank you. Thank you, council, for giving me the opportunity to present.
Got to go into the mic.
Pull it down.
Sorry.
There
Okay.
you go.
Thank you, council, for giving me the opportunity to present. I'm Dr. Donna Lisi. I'm chair of the Board of Health Advisory Council. I want to thank the council. I want to thank Mike and Rashida, and I also want to give a special thank you to Councilman Karazi. He's been a great support since I took over this role in January of this year. So what I want to do in a little bit of time remaining is I want to share some of the things that we've been doing and some of the things that we're looking forward and some of the things that I feel we could be doing even more and addressing some of the concerns of the community. Okay, so this is our mission statement. I won't read through this. This is the mission statement of the Board of Health Advisory Council. And these are our goals, and so some of the things that what we talk about today are to help meet some of the goals. I do have to say that one of the goals is me to change that first one, and I have to find out the protocol since I'm new to this, the Franklin Township Health Department. So since we don't have one, I don't know if that has to go through some kind of protocol to get that wording changed. So these are our members as of 1/3/24. I'm chair, and we have a number of very qualified people in our committee. We have nurses, we have EMTs, we have mental health professionals, we have neuroscientists, and we also have a JD candidate. So one of the goals that has been my focus since I've took over this is education. I think as a Board of Health Advisory Council, we should be very educated in terms of the resources and the problems that are out there. So my first effort was to bring in the Department of Human Services and to learn about the mental health services that are provided at the county. I should also say that I am chair of Somerset County Local Advisory Council on Alcohol and Drug Abuse. I'm past vice president of the Office on Aging Advisory Council, and I'm on the Municipal Alliance of Franklin Township, as well as a member of the Somerset 100 and Safe Coalition. I'm one of their stakeholders. So pulling upon my background and all the resources that I have access to, I'm trying to educate our group so that we know how to direct people if the event that services and issues come up, and how to direct people. So the second, that was in February. In March, I had Safi and Tara come and speak to us on the local needs assessment and action plan. And so a lot of the actions that have been taken since then have tried to address some of the needs that have been identified. In April, I had the police department the police department actually had their Arrive Together team come. We had Officer Reyes and we had Nicole Crowley come and speak to us about the Arrive Together program, which is an outstanding program that is being copied in other municipalities as well. They're trying to reproduce that. And then May, I had Dr. Ken Finn, who is a physician, board certified in pain management and rehabilitation medicine, speak to our group about the Colorado experience when it came to cannabis legalization. So he talked about the impact that it's had on his community. He's a co-founder of the International ISAC, the International Association for the Science and Impact of Cannabis. And so I'm also an affiliate member of that group as well. And then on June 5th, we had an open discussion since we've been having guest speakers come in, and one of the things that we focused on is looking at the needs of our community regarding the mental health crisis, the Middle East crisis, and the mental health impact it's having on our community. So those are some of the things to just give you a background of some of what we've been doing on a monthly basis. In terms of some of our accomplishments, and this I have to credit Councilman Karazi for, is that we had naloxone added to all the AED boxes in the township, which was something that was modeled after what the county had done. Also, too, I attended a program, the Mental Health Matters, which was a program from Rutgers that was held at the Youth Center on January 7th, in which I promoted the work of the Board of Health Advisory Council and making them know that there was a group that they could bring their concerns to. I also participated in St. Matthias Self-Care Fair, where I was able to get naloxone from the county. So when the harm reduction organization out of New Brunswick had run out of nasal naloxone, I was able to provide them with kits. And then another important thing is, I mentioned I'm a stakeholder for the Somerset Safe Coalitions, and so I partnered with them, and with the help of Dr. Karazi and a number of other people in Parks and Recreation, we were able to bring a bench to Franklin, which sat outside the senior center for about 2 months, which focused on looking at alternatives to opioids. And so this is the bench. And what's important about this bench is that this bench was actually built by one of the members of that organization, and it's designed so you can't sit on it. It's not comfortable. There's a QR code on it that when you scan that, that will go to give you options for alternatives to opioids. This was actually streamed live. P.G. Parker from the Franklin Reporter was there and did a whole segment on that, about the bench and the opportunities. And so that QR code leads you to this page, looking at alternatives to opioids and other things, including non-pharmacological interventions that could be used to manage pain. In conjunction with that, I conducted an opiate education workshop on April 30th at the Township Senior Center, looking at talking about pain management, opiate use, as well as giving out naloxone to the members who attended that workshop. Other things, like I mentioned, Safi and Tara had come to speak to us regarding the local health needs assessment, and I had asked them prior to coming to identify some key issues that they thought would be something that our group could take up. So these were the 4 things that they identified. Mental health services need to be prioritized. There's a lack of knowledge and or understanding related to services available to those with disabilities. Specialized emotional and social services are needed for senior citizens, and residents would benefit from free or low-cost preventive screening and medical intention. Regarding the first couple, like I mentioned, I'm chair of LACADA, which is the Somerset Local Advisory Council on Alcohol and Drug Abuse. So I work very closely with the Office of Substance Abuse and Addiction and the counselor, actually the coordinator for the county, which is Lisa Federico. She actually spoke to our group back in February. So the county has launched an excellent program used initially out of opiate settlement monies, which was a behavioral navigator program. So this is now, they have a person that's dedicated to helping citizens of the county identify resources for mental health. So if someone would call her, she would be able, based on your insurance, based on the type of need, based on the type of patient, to give them a list of resources and places that they can go to for help. That website is now live as of just within the last couple of weeks, where someone can go to that website, check off a bunch of boxes, and get a list of providers. There's over 100 providers that are listed there. They've been vetted, and so that is an ongoing process as they become aware of more councils and other people who provide mental health services, and they get vetted, they'll add them to the list as well. I have also brought our needs to the local advisory council as well as to the Office on Aging and Disability. And so trying to share resources like the Office on Aging, Somerset County Office on Aging and Disability had a disabilities fair where they had a number of vendors and other resources available to educate the public about the types of services available. So those are some of the things that we're working on. I also frozen. Okay.
You want to just go?
It's
didn't
not,
work?
no, that's what
Because it's,
that's what I was doing. Maybe I stayed on one slide too long. Okay.
So while you're doing that,
Okay, sorry. Okay, so this is another thing. So just recently, the state changed the requirements for prescription medications for seniors, and so and for the indigent. And so I updated. I created this handout that looks at the different programs, the PAD and the senior goal, and Councilman Karazi was nice enough to photocopy these for me, and he distributed them to the Franklin Senior Center, and I gave these out at the Office on Aging to help beyond our group. Other things, our group participated in the Franklin Township Needs Assessment. I personally was part of the focus group. I also participated in the Somerset County Department of Health survey. And on Thursday, I believe myself and another member will be participating in this focus group that the Department of Health is having. And the point of all these is to help assure that that the diverse population health needs of our community are being addressed. Also, too, on May 22nd, I attended the Rutgers Cooperative Extension Network event. This was the first time they had such an event. It was held at the 4-H Center. And so one of the programs that Mike had mentioned, Katie Stewart is the public health educator coordinator for the chronic disease management. She was talking about, when she was presenting there about the cancer program that they have for cancer survivorship, I hooked up Mary Ann Regan from our township with Katie, and now that program is going to be brought to Franklin Township. Other things, on June 15th, the Power Somerset donated 48 kits, naloxone kits, that were distributed to the coordinators of the Franklin Juneteenth celebration. In those kits were a box of naloxone as well as a skin wound care kit, because in case substance drugs of abuse are contaminated with xylazine. I also had a rebreather mask in case someone has to offer CPR, as well as a resource guide and gloves. Okay. And then, so ongoing, just so the council knows too, Communities in Crisis is a peer recovery specialist organization that does harm reduction. They're based out in Burnsville, but every third Thursday of the month, they come to Franklin. They've been coming to the First Baptist Church, and they bring with them naloxone, fentanyl test strips, xylazine test strips, and anything that could be have to do with harm reduction, as well as they give presentations on different areas that could help people with life skills. So that's one thing that I want to encourage, getting the word about that. Also, I will continue to partner, and so will our members continue to partner with any organization that we feel can benefit the residents of Franklin. Also, with the opiate settlement monies, I know those are off with the police department, and I've been in touch with Officer Merriweather about that, and insist any way that is necessary or that would be desired to help identify issues or areas that those could be spent. One of the things that I do as part of my role in LACADA, we actually have a subcommittee that looks at hotspots and looks at where we have overdoses, and there have been a number of overdoses. This year so far has actually been a regression. We're actually seeing more overdoses, and so there's been a number of hotspot areas, like we're on the border of Franklin and New Brunswick over on Eastern Avenue, so keeping an eye on those. And then also disseminating any community events that I become aware of that we could share with the community, as well as sharing with the Board of Health Advisory Council, so they could share further with the community. So looking forward, one of the things that, thanks to Councilman Karazi, we were able to become a part of the network of the New Jersey Local Board of Health Association, so we're now members of that. So going forward in the future, we're going to invite them to come and be guest speakers. That will be a great opportunity for us to learn about what other boards of health advisory councils are doing, and being able to give us some ideas on how to be creative and looking at certain issues that we may not have on our radar right now. In addition, looking at bringing in, like I said, education's been a main focus of mine, so bringing in to educate about other things. One of our members has reached out to the food bank, so probably August or September, we'll be having the food bank come to speak to us about food deserts and issues like that, trying to identify and address the social determinants of health that can impact our community. Other things, I've also gotten the phone number for the housing person, so looking at that to see if that's an issue in Franklin and what we can do to address those issues. And then also, I attended an excellent presentation on human trafficking. I think that's something that we don't clearly recognize, that it's in our own community. So trying to make our board aware of that, and then trying to make the community aware that this is something to be on the lookout. And then the last thing was also to promote goals and mission of the Franklin Stigma-Free Council. I'm also a member of that. I am heading up the ageism subcommittee on that. And so what we're looking at right now is to develop an intergenerational art project where seniors from the senior centers and maybe the youth center can partner on things. Another goal, and this is a particular goal of mine, would be to also consider looking at Franklin becoming an AARP age-friendly community. And I just put in the white area there that this is something that has actually been on Governor Murphy's agenda, that he's trying to promote that throughout the state. So things to consider for the council. We do all this with no resources. So as a council, we don't have a budget. So when the secretary or the acting secretary has to do minutes and print them out for the group to review, they're doing that on their own printer with their own ink. So that's one thing. So that's something to consider. Other is to need better coordination between not only the Somerset County Board of Health, because as you know, the Board of Health does a great job, but even the needs that were addressed in that needs assessment go beyond the Board of Health. And so looking at things like mental health issues and trying to reach out to other Somerset County agencies to address the needs of Franklin. And then also to identify ways to reach the diverse population in Franklin, the shut-ins, English as second language, not just those who participate in surveys or focus groups, how to reach those people to identify what their particular needs are as well. And then this is something that is a particular concern of mine. And this is something where, and I know, and I'm speaking now more for, this is not something that I've cleared. In fact, I do want to take a step back and say that these slides, I wasn't even aware that I had to give these to council. In fact, this is new. I didn't even find out till just today that slides were an option. So I apologize if the council does not have this. And so my board doesn't, my council doesn't even have these slides, besides just the council here. My Board of Health Advisory Council doesn't have these slides. These slides were just created today. So one thing I do want to recommend or do stress, just food for thought, is that we have a lot of cannabis establishments approved in Franklin and probably more on the way. And more the data is showing that there is harm associated with use of cannabis. We're seeing that there are increases in the rates of psychosis. We're seeing that there are increases in the rate of cannabis use disorder. And when we look at adolescents, we see that they have a higher risk of that. And so I just have some information here, and so maybe even this is something that can be done in coordination with the police department or just a task force to, you know, we're approving these things, but what is going to be the impact on the community? And that is my very great concern, because I like I said, I'm on that international organization as well, and I've seen the things that have happened in other towns where this has happened. Increased motor vehicle accidents, increased, like I said, cannabis use disorder, psychosis, and then another thing that's happening too, increase in cardiovascular effects. We know that there have been a number of patients who develop heart attacks, ischemic events, and stroke, and those things have all been increased by the use of cannabis. And I won't go through all this, but that was data that I showed you there from SAMHSA, the Substance Abuse and Mental Health Services Administration. But I do want to, for the sake of time, I do want to point out, now that edibles are coming, this is something that is extremely concerning, because every area that has approved cannabis edibles has seen an increase in pediatric toxicity. This was an article that I actually published in 2022, before they were approved for use here. And then this is data from the National Poison Data Center, and it's shown that progressively the number of cases of pediatric admissions due to cannabis edibles has been increasing every year as more and more states come on board with both recreational and medicinal marijuana. So this is something that I think that we really need to, I don't know how, and I present that to the council for their guidance on how that we should be, how we can look at this and to make sure that our town is safe, to make sure that if people do use this, that they're educated, that they know to lock this stuff up. And it's not only, and the problem goes beyond locking up, because, you know, if they bake things with it, know to keep those things out of reach. So there's so much, I think, that we need to do as a town, especially since we have so many establishments in the area. And I think, oh, hold on, every time. Oh, I know we're running short on time. The same problem again. So I just, 2 more slides, Mike? Sure. Okay. I don't, okay, okay. I have a touchscreen at home, so.
Yeah.
Okay, thank you. Okay, so I just did want to point this out. So this is data looking at toxic effects and where the critical breakpoint level. And so if you look at the weight of an average or 5 or 6 year old, okay. So this is data that looks at toxic effects. If you look at the average weight based on the World Health Organization of an average 5 or 6 year old, you can see based on the number of kilograms, all it would take is 3 gummies, because the gummies traditionally are 10 milligrams. 3 gummies to produce a severe adverse effect in a little one. And who would eat 3 gummies? I mean, you know, so if they ate a whole package, the effects would be even more severe. Okay, and this is just what I was saying. This is what the American Heart Association came out talking about, the harmful effects on increased risks of stroke and all. But see, the problem is I don't think the public knows this. And I think it's important to get that word out. And then this is something that actually this was from a little while ago, New Jersey Poison Control Centers are seeing an increase of children being sick from marijuana edibles. So this is happening in New Jersey. So as I mentioned, I'm privy to the data in Colorado, but we're actually seeing this happen in New Jersey already. So with that, I want to thank you for your attention and consideration.
Thank you. You've really done wonders with the Advisory Board of Health.
Thank you.
Yes, I
Leaps and
second
bounds.
that, Mayor.
Leaps and bounds forward.
Thank you. Does anyone have any
Continuing,
questions? I'm sorry. I didn't ask.
Hi, are we able to get a copy of this deck?
Sure, I'll
sent
send
over?
you that,
Okay,
yes.
thank you.
I'll send it to Anne Marie. Okay,
Thank you.
thank you. I apologize that you don't have it in advance. Okay, thank you.
okay, we need to have a public session on the Board of Health. So do we have a motions open for Board of Health public session?
So moved. Second.
Moved in second. All in favor, say aye.
Aye.
Opposed, say nay. Motion is carried. We are open for public discussion on Board of Health matters only.
Seeing no one coming forward, Mayor, a motion to close the public portion of the Health Board meeting.
Second.
Moved in seconded. All in favor, say aye.
Aye.
Opposed, say nay. Motion is carried. Do we have any other business? Any other council members have anything? Okay, I'll take a motion for adjournment.
Second.
Moved in seconded. All in favor of adjourning the Board of Health meeting, say aye.
Aye.
Opposed, say nay. We are adjourned for the Board of Health. And, okay, so we will start in 5 minutes. That is This work session, regular meeting of the Township Council is called to order. Madam Clerk.
In accordance with the Open Public Meeting Act of the State of New Jersey, adequate notice of this work session regular meeting of the Franklin Township Council was made as required, indicating that this work session regular meeting would take place at the Municipal Building at 7 p.m. on Tuesday, June 25th, 2024.
And again, stand for the Pledge of Allegiance and remain standing, followed by an invocation from Councilman Ram Anbarasan. Pledge allegiance to the flag of the United States.
Let us take the next few moments of silence to each seek in our own way whatever sources of inspiration will grant us the strength and power in our thoughts and decisions to be for the benefit of all people at all times. Amen.
Thank you. We will now, I'm still standing because I'm going to get up. So we're going to have the swearing in of the police chaplain.
We got to take the roll call.
Oh, I did it again. And this time, no excuse. Madam Clerk, please call the roll.
Councilman Embarrasson?
Here.
Councilwoman Francois? Here. Councilman Karazi?
Here.
Mayor Kramer?
Here.
Councilman Onijaka?
Here.
Deputy Mayor Potasnik?
Present.
Councilwoman Udine?
Here.
Councilman Vasanella?
Here.
Councilman Wright?
Now time for commendations and proclamations. Swearing in of the police chaplains.
Good evening, everyone.
Good evening.
I'm Captain Sean Hebben from the Franklin Township Police Department, and today, as they stated, we're here swearing in new police department chaplains. Chaplains are no stranger to Franklin Township Police Department. We've had them here before. However, under the direction of Director Corvella Mayweather, we revamped and updated our chaplain program. These are 3 out of the 5 chaplains, possibly 6 that we're going to be swearing in. And Franklin Township Police Department is a very diverse police department that represents a very diverse community. We also wanted our chaplains to also represent that diversity. So you'll be able to see here a range of different faiths and a range of different backgrounds to offer those services to not just our police officers who are in need of prayer at times, and police officers do need prayer. We're people that, are going into the thick of things sometimes. Our officers are people, and sometimes they hurt and suffer as well as members of our community. There are things that happen here that require us to go beyond just going and serving and protecting through whatever we carry on our duty belts. Sometimes we have to really dig deep into helping someone in a deeper way, and that's where the chaplains come in, and it could be of great support for our agency. So here we have today Rabbi Eli Garfinkel, who has been a chaplain from way back when, I don't know, 18 years. So he has a lot of history here with Franklin. He's been with the chaplain program in the past, and he's here with us continuing on to serve today. We have, and he's representing Temple Bethel. We have Reverend Jamin Powell from Community Baptist Church, who's here, and you have some background as well in chaplaincy from previous Orange County Sheriff's Department. And we have Father Simon Simon L. Hodge. That's it, all right? Perfect, all right, from St. Charbel. Not here with us today is going to be Reverend Dante Quick from First Baptist and Imam Syed Rizvi from Masjid ELE.
I state your name. Do solemnly swear that I will support the Constitution of the State of the United States and the Constitution of the State of New Jersey. That I will bear true faith and allegiance to the same and to the governments established in the United States and in this state under the authority of the people. That I will faithfully, impartially, and justly perform all the duties of Police Department Chaplain, the Township of Franklin, according to the best of my ability. Help me God.
Once again, we are faced with our diversity, and we display it here and with the other two, and we're better served this way. I'm sure each of you will contribute, and it sounds like you've already done some in the past. Do either of my colleagues have anything else to say? Congratulations. I know you guys are not shy about talking.
Give a man of the cloth a microphone and see what happens, Mayor.
We can't help ourselves. For 18 years, the phone, in terms of the chaplaincy program, has been very, very quiet. In fact, there have been no calls that I know of. On the one hand, I hope that the phone remains quiet, because if that phone rings, that's not good news. On the other hand, I hope and I know that my colleagues and I will be ready to help should that need arise.
The next item is the 2024 Pride Month proclamation.
I'm going to ask Officer Pooja Patel to come join me from the County Sheriff's Office. Happy Pride, everyone. This is a proclamation for Pride Month, whereas Pride Month serves as a time to celebrate the remarkable contributions, culture, and history of LGBTQ+ community, recognizing their resilience, diversity, and spirit in the face of adversity. And whereas despite significant progress, the LGBT+ community continues to face discrimination and inequality, making it essential to stand in solidarity to advance justice and ensure that every individual is treated with dignity and respect. And whereas the theme of Pride Month of 2024 is Embrace the Spectrum, and encourages us to acknowledge and celebrate the full diversity within the LGBTQ+ community, including different sexual orientations, gender identities, and expressions, and fostering a more inclusive society for all. And whereas we honor the contributions of LGBT+ individuals in every aspect of life, from arts and culture to science and technology, from politics and activism to business and education, and we recognize that our communities are enriched by their presence and the achievements. And whereas it is crucial to educate and raise awareness about the history, struggles, and triumphs of the LGBT+ community, promoting a cultural understanding, acceptance, and love. And whereas we affirm our commitment to creating safe and inclusive environments for all people, regardless of sexual orientation or gender identity, and we pledge to continue to work toward equality and justice for all LGBT+ community members. Now, therefore, we, Deputy Mayor Ed Potosnik and Mayor Phil Kramer, on behalf of the entire council, do hereby proclaim June as Pride Month and call upon residents of the Township of Franklin to join in the celebration of our diversity and to stand up against discrimination and prejudice and support the ongoing efforts to secure equal rights for all members of the LGBT+ community. And I just wanted to share a sort of personal note. We had a Pride Month sort of inaugural celebration in the gazebo just a few weeks back that was very well attended. I think that's going to be something we continue to do in the future, and I invite more folks to participate. If you're interested in getting more involved, definitely let me know. As the first, we say openly gay member of council, because there probably were some folks before that weren't open, or maybe they didn't know, and we want to recognize that as well. It's really important to have strong allies like the mayor and Officer Patel, and I'm just going to turn over to them if they want to share anything for Pride Month. You got to get really close because the people at home.
I just want to thank you guys on behalf of the Somerset County Sheriff's Office, our LGBTQ liaison, Sergeant Hahn, and Officer Ski were not able to make it tonight, but on behalf of the Community Outreach Program, Bias Hate Crimes, we appreciate Franklin Township making this acknowledgement. I think it's very important for everyone to be included, especially, you know, how everything is today in today's day and age. I think it's very important that we give everyone the equal opportunity, so thank you, and thank you all of the board members and council.
I will mention, too, we should give her a round of applause. She's a graduate of Franklin, lives in Franklin Township over 20 years. Let's give it up for Officer Patel. Thank you. Please pass it on to your colleagues. Thank you.
Very quickly, we've made great strides in the LGBT community over the last decades, and I fear that's slipping backwards. So we can congratulate ourselves for where we are, but we need to stay vigilant. Thank you. Okay, it's now time for public discussion. Do we have a motion to open to the public?
Second. Mr. Mayor, if I may make a statement before we start the public discussion.
1 second, let's just take the vote. Thank you, though. All in favor say aye.
Aye.
Opposed say nay. Motion is carried. You want to make a statement before public discussion?
Thank you, Mr. Mayor.
One moment. If no one has any objection, we'll do this by unanimous consent. Go ahead.
Thank you, Mr. Mayor. Good evening, and thank you, everyone, for coming. We have seen many of you coming and asking the council to present a resolution calling for ceasefire in Gaza, not only by Palestinians, but also by Muslims and non-Muslim community members. We have heard some of you express a fear of bias and bigotry and hate. We recognize that the uncertainty about the safety of the people in the Middle East, in particular in Israel, in Gaza, West Bank, and South Lebanon, weigh heavily in the minds and hearts of many of our community members. So it's natural for us to be saddened and feel the pain and even shed tears when we see you are coming here, speaking to us in pain and sometimes in tears, or sending us emails sharing your pain as well. I would like to make the following statement as your brother in faith or equal in humanity, as your neighbor, as your friend, and as your councilman at large. As you have heard several times, this council has had a policy to only present resolution to matters relating to Franklin. After President Biden called for a ceasefire, during my June 11 council meeting comments, I suggested council to discuss possibility of reviewing that policy. I discussed the suggestion with council members, not once but twice, and after thoughtful consideration, it is believed it is the right thing for our town to continue the current policy. I'm sorry if some of you are disappointed to hear this, but this has not been an easy decision for us, especially for me as the past president of Interfaith Council and someone who always has promoted peace and peaceful coexistence. Let me also mention that this policy is not only just for the international matters, but also applies for other matters in the nation. In fact, one of my colleagues gave an example of Mr. George Floyd, who was murdered by police. And this council, at that time, stayed out of presenting a resolution to condemn his murder. As always, I am committed to help to bring the community together and promote mutual respect. I have reached out to the Interfaith Council president and participated in their meeting last week. They are planning to have a meeting when several faith leaders will discuss ways to have a hate and bias-free community with mutual respect, to recognize each other's humanity, to care for those who grieve, to pray for peace and justice and mutual understanding so that strained relations can find healing. They are also planning to organize training on bias, hate, and civil rights, most likely on July 31st, starting at 6 p.m. in the Senior Citizen Center. There will be some discussion about mental health impact of bias and discrimination. I encourage all to participate and support the Interfaith Council's effort. The second phase mentioned by the Interfaith Council is a possible town hall meeting. Finally, some of you may have remembered the resolution the Council issued last December about peace and rejection of hate and bigotry. Copies of the resolution are on the table, and I would like to read the 4 elements the Council noted. The Council of the Township of Franklin has zero tolerance for any form of hate, bigotry, and discrimination of any kind against any race, religion, nationality, ethnicity, gender, or persons, and is committed to uniting the Franklin community and ensuring everyone feels respected and valued, and ask all residents to respect one another despite our differences and reject any form of hate and bigotry, and wishes peace and harmony prevail around the world. We pray for the war to stop and a lasting peace return to the region. Thank you, Mr. Mayor.
Thank you. So now anyone wishing to speak may come up. You'll have 5 minutes. No yielding of time, may only come up once. Please address your comments to the council.
Good evening, council members. My name is Shamsa, and I reside at 14 Sebring. We just heard the health advisory mention the impact of the crisis overseas on mental health in our community, and I wanted to begin by thanking you for opening the public portion of the meeting, acknowledging the pain in the community. One of the concerns I wanted to address that was brought up by the council members was the worry, repeatedly, was the worry that the choice of words can cause further division in the community, as something that was holding the council back from, even moving forward with a resolution. Indeed, words are very powerful, but we are overlooking their power to unite such a diverse community as ours. Out of more than 100 resolutions passed in the U.S., I wanted to read one of them. It's a short one out loud. I will not take the name of the locality because I want all of us to hear what a ceasefire resolution that represents a diverse community sounds like. Resolution calling for a sustained ceasefire in Gaza, humanitarian aid, and release of hostages, and condemning anti-Semitic, anti-Palestinian, and Islamic rhetoric and attacks. Resolved that the Council calls for a sustained ceasefire, provision of life-saving humanitarian aid in Gaza, and the release of all hostages. And be it further resolved that the Council urges the Biden administration and Congress to call for a ceasefire humanitarian aid, and the release of all hostages, and be it further resolved that the Council condemns anti-Semitic, anti-Palestinian, Islamophobic, and xenophobic rhetoric and attacks, and be it further resolved that the Council condemns Hamas's attacks on Israeli civilians, resulting in the deaths of at least 1,200 Israeli people on October 7, 2023, and be it further resolved that the Council condemns the Netanyahu government's attacks, resulting in the deaths of tens of thousands of Palestinian civilians in Gaza, and be it further resolved that the Council believes that a just and lasting peace between the Palestinian and Israeli people requires new leadership on both sides, and a willingness to commit and commitment to negotiate in good faith, and be it further resolved that the Council urges the international community to work with Palestine and Israeli people to find a just and lasting peace, and to conduct a full investigation of the conduct of all parties in this conflict, and hold all parties and individuals who have overseen or engaged in war crimes and international human rights violations, including but not limited to gender-based violence and killing of children, accountable. For anyone wondering, this resolution was passed in January of this year in a West Coast city of about 1 million residents. And I'm just curious if anyone found anything controversial or divisive. Is this a resolution that you can stand behind? I want to remind everyone that while we wait for what is the most harmless action that can be taken, a ceasefire resolution, children continue to be massacred. Children like Hind Rajab, who waited in her car, a car full of her dead relatives, for rescue, but instead was killed. I think last we heard by 335 bullets. If they're not killed, they're left injured without limbs, for a lifetime of disability. There are countless who are trapped under rubble, and countless children who are orphans. The resistance or the reluctance to call for a ceasefire resolution, to me, because I've been an educator for a long time, is strange to me. I understand your policy, but I think we can all agree that it is important to collectively voice our stance against the senseless death of children. Thank you for your time.
Thank you. Anyone else wishing to speak?
Good evening. Manager Sabah, 146 Emerson Road. I came here tonight not knowing what resolution being presented. Thank you for the people who have presented this resolution to have ceasefire. But I wanted generally to talk about this and what is happening in our own township. I just had a few hours ago talking to a friend who's also a realtor in the township, and she told me that she's leaving the township. She has been living here much longer than I have been here. She's an African-American woman. She has been forced to send her mother to California from here, and she's moving herself out of the township. And she said to me that there are many people who are leaving the township because of the right-wing reactionary, and I'm adding this fascist group of individuals that are in the township as harassing the neighborhood. For example, I was told, and I haven't observed this, but I can easily understand it, that there is a neighbor of this friend had a big megaphone of some sort a night before or 2 nights before at his house at night, and having all sorts of right-wing reactionary discussion and music and everything else there. And I said to her, why did you call the police? She said, I would not call the police. She's scared. And to me, and most of you know me, I am somebody who works on human rights and is offensive to me. For example, I don't know if Township has any limitation to the size of the signs posted in the township, whatever signs they are. There is an offensive sign on the Mott Lane. huge sign. I have sign on my, many of you have seen, I have sign. Usually I have peace and justice signs. But this sign is overwhelming. People have called me and said, have you seen this sign? Because I usually don't go to the Mott Lane. I use Emerson Road to go in and out. And also there is, I was told again by this friend that on the corner of New Brunswick Avenue and Cedar Grove, this business has taken its American flag down and put a right-wing, slavery time type of flags all around there. I don't know what we can do, but I thought it's my job, especially my friend said, I'm not going to do anything. I said, but I cannot sit quiet when I see people are being run out of this township because a bunch of people, for whatever reason, whatever purpose they have, they're harassing the community and forcing them to leave the community. And that's why I came here. And I would like you to discuss it, do whatever you can do with it. If I can't be quiet about this. I have been crying for 7 months for Gaza. It's unacceptable that for years and years and years I've said people didn't know when Holocaust happened. But now everybody, the whole world knows that Holocaust is happening in Gaza. And it's going to expand. It seems that it's going to expand. I cannot be silent, and I would have my voice all the time here. From now on, I'm going to come here and go everywhere, and I'm willing to do work with anybody and everybody who wants to work on these issues. So we stop people from leaving. This is absurd. 2024, people are leaving their home because they're forced to leave their home, because they're making their life miserable. Should be unacceptable. One thing that has been on my mind to come to the council and talk about is about the green resolution that we have. What's happening with that? Is it being implemented?
Answer questions afterwards.
Okay, so that was my question. Thank you for listening. I know what I was just said brings pain to everybody who has lived here. I know everybody here has been trying to make this, bring us to the point that we have the diverse community that we are. But I needed to talk about this and bring it to all of our attention. Thank you very much and have a good evening.
Thank you. Anyone else? On forward.
Thank you, everyone, and good evening to you. I happened to notice that there was a debate on this issue a few days ago while I was in Kettleman's having a bagel, because they have the report, the Franklin Reporter over there. I didn't even realize that this was a topic that was being discussed at a council meeting, and I respect your decision not to make a specific decision, a council decision, on this particular matter. However, for some reason, many people have forgotten that there was a ceasefire in Gaza. It ended on October 6, 2023, by a horrendous attack on Israel. I'm sure the people who somehow did not remember that are undoubtedly unaware of the fact that years ago, Israeli troops came into Gaza in order to remove any Jew who was still living there, because they knew they could not live in Gaza. There would be no peace amongst the people if Gaza were to be ruled by Muslims, by Arabs, by Islamists. So they left, and there was no Israeli presence there. Only when at the border there was a great many instances of border attacks. Something had to be done about that. We know about borders in our own country here. So in any case, there was obviously the IDF did get involved when there were border attacks. Okay. I think I should also remind people that Hamas did not end the war on October 7th. If you were to read most of the media, you would think that attacks were only occurring from Israel. Nothing could be further than from the truth. There are still Jews that are in Gaza. They are all called prisoners at this particular time. And they are being mutilated. And they are being mutilated. So, I must tell you that I very sincerely care about innocent people who are being hurt or murdered, worse. I am not asking you for any resolution. I am asking you a council resolution, let's put it like that. I'm asking you to kindly look into your heart, your head, determine what you feel is right, and discuss it individually with your own groups, your families, your friends, your co-workers, whomever, and do the right thing. This is it.
Ma'am, you have to speak into the microphone. You have to address council.
Okay. Can you read it? Demand Hamas surrender. That is what has to be done. They haven't shown any sign of adhering to any kind of ceasefire as they are continuing to fire weapons at Israelis and continuing to mutilate the hostages, even probably after they are dead. Thank you.
Anyone else wishing to speak?
Hello, Council. Doc Cunningham, 11 Star Court in Somerset. I stopped by today in person to express my thanks to some of you individually and probably to most of you collectively for the chance to gain your guidance and support over the last 5 years with See America in Color. As you know, See America in Color, as we call it, SAIC, is a social edge campaign and platform that brings a better picture of civic and social issues for a higher level of citizenship. And I'm grateful, and I won't call you by names, but you guys know that I've worked with you over the years, and I just stopped by to say thanks. And I know there are monthly updates that are shared via email, and some of you receive those updates, and I will acknowledge you as well there. But every now and then I think it's helpful to stop by in the flesh, in person, to look at each other eyeball to eyeball just to express my appreciation. I had a chance to attend the Juneteenth event recently hosted by the Somerset County Board of Commissioners. And let's just say it was an awesome event, and a number of public officials were gathered there. They actually got honorable mention. And one of the performers mentioned something that struck with me. She said that as a community and as a nation, we need to elevate, we need to raise the relevance of civics in the public space. And as you might imagine, that felt like music to my ears. I felt like I was in the right place at the right time. So I wanted to stop by today to share with you a public interest proposal along those lines that basically has two elements, two broad elements. One is takes a page from history, so it's a historical look back, takes a page from the summer of 1787, when our founders got together and laid out what I like to describe as a vision for the Republic based on citizenship and leadership. And one of the things we're drawing from that will potentially lead to a resolution, and I hear that word called quite a bit today, a resolution that speaks to even some of the ethnic and cultural and civic conflicts that we're dealing with today. The second, the other side of it is a call to action. And that call to action, I believe, will leverage the participation and involvement of public officials, public servants across all levels. So I just stopped by to share that in brief. I will be sharing more information with some of you via email. So I didn't want it to drop in your inbox and you says, what's this all about? At least you have a preview of things to come, and I'm hoping to have your support as many of you have shown over the last 5 years. Let me leave you with this. If 50 years from now, or 100 years from now, someone in your seat were able to look back and say, you did something monumental, something pivotal in the life of this country to advance civic ideals and greater public good, would you want to be in that number? And so I leave that thought to you, and I look forward to chatting and exploring this conversation further. Thanks much.
Benjamin Guy. Pretty much, I just wanted to highlight,
please.
The young lady didn't state her address, not trying to be disrespectful.
And I missed it.
And she didn't even state her name, so I understand. So I'm not trying to be disrespectful. Huh? So.
35 Patton Drive,
See?
Anne Marie.
See, you got it. See, you guys all know, so I don't have to repeat.
So I made a mistake.
I understand.
I'm sorry.
So we're good. I just want to be consistent. So real quick, just for noting events that are coming up during the time frame. I know Mr. Von Luck will probably highlight this, but just want to make sure the community was aware for what was going on for July 4th weekend or July 3rd that we're going to be highlighting here. Again, also in August, we're trying to look at National Night Out, just to make sure that if there's anyone who wants to participate with that, with the police department, that wasn't brought up yet, and also Week of People Festival that will be coming up in August also, because that is one of the things that people can plan for, that the community can come together on and actually work together on for events at all. Second portion, I just wanted to put this out here because this came up in a Hamilton Street Board meeting during the time frame with two of the council people, and they can comment on this afterwards. Was that one is if there's advisement on how we handle certain things at all, I would like to get a consensus from the town council about recommendations to improve stuff. I'll take an example from Hamilton Street Board, whether or not it's the planning board or any of the other boards that we, or subcommittees that we have. Some of these committees are involved for extended periods of time frame, and they've been established for a long period of time frame. So sometimes we need to reassess how they're being handled and what they need to be done, and reassess how their performance will be done in the future. I'm asking the town council if you have recommendations, because it was brought up during the Hamilton Street Board meeting, to actually say if there's a consensus report that you can give to us that we can actually review on recommendations that you guys want us to take care of, please do that and have it done probably over the next 2 months, because we won't be meeting again probably until August, so that we can reassess and look at that for advisement going forward in the future. Because as we move forward, I want to make the recommendations for things like Hamilton Street Board to be labeled, and this goes back to the town council again, as a Main Street district. Because again, we don't really have a Main Street district in here. But with all the development that has happened there, we need to maybe classify it as a Main Street district so it can be regulated around the state, and it corresponds with a Main Street district followings at all, so that it can be funded and it can actually be properly done in the future to actually be handled that way. So that is something that the town council can make a recommendation for, because in their bylaws, when it was actually formed, it was formed in the essence from the town council's recommendation back in 2014. So that is something that can be actually reassessed and redone altogether. That would actually help to improve with funding acquisitions, actual community programs, and social initiatives that actually can be done over there, whether or not it's for housing reforms that we actually need to be done during in the period of time going forward in the future, which is part of the correspondence that we need to look at for affordable housing reassessments that's coming down the pipeline at the end of this year. So that is a recommendation to the council to actually look at and maybe mandate that is something that the Hamilton Street Board actually looks at and does for the whole city. So that is one thing that I would make a recommendation on. The second portion is that this will go to Mr. Von Locker altogether, is that for what we're doing, as we see all these roadways improvements that are going on, I just want to see whether or not we're talking about infrastructure spending and actually improvements that are going on in the city. Is there a way that we can have a posting that's supposed to happen over the next 3 to 5 years that we can actually put up so that the city or the township knows exactly what's going on, whether that is roadways or anything else, so that the city can actually make correspondence information relays to other people that are in the areas, whether or not it's elders or anybody else that might not know that certain roads might be blocked off at a certain time frame, or there's road work that's going to be done in certain areas. I know we're trying to improve and do sidewalks, but I would like to be a little bit more informative because we are expanding and there's a lot of construction that's going to be done, especially with housing developments that are getting approved in the planning board. So I would like to make sure that that's being done. And then the second thing, the last recommendation that I actually wanted to say is that because we have a public health crisis that was just labeled out by the health advisor for the United States at all, saying that gun violence was one of the biggest epidemics for youth at this specific time frame. I would like to look at how we're going to handle this from a mental health standpoint, as far as advisement, not a legal standpoint, going forward with the youth and actually advisements going forward in the future. So that is one of my recommendations going forward at all. Thank you.
Anyone else?
My name is Mohammed Salahuddin. I'm resident of 120 Delmonic Avenue.
Thank you.
Thank you very much. Okay. Respected Mayor and Council members, just wanted to put certain points before the Council members to, especially on the record. Respected Speaker, the senior citizen here, talked about doing something about this ceasefire and all this thing, about the conflict that's going on in the Gaza and all. One thing I just wanted to make sure that please remember that history did not start on October 7th. It started long before that one. The oppression of the Palestinian people started somewhere in 1948 with the Balfour Resolution, or even before that one. And it is something that what is taken out of context here is what's happened on October 7th. We all agree that it is heinous crime. It's not a good thing that has happened, but what is the impact of that? What's the retaliatory thing that Israel had done to the innocent children, 35,000 children, one small kid getting 355 bullets? I mean, can you imagine that one? And also, recently, many of you must have seen Israeli soldiers in a van tying up a Palestinian person or Palestinian wounded because they wanted to have a human shield. Is this humanity? I mean, somebody is talking about something which has happened on October 7th as if that's the start of everything. No, it's not the start of that issue. This issue goes back to long before than that one. And if someone comes to my house and occupies my house and says, you have to be a slave to me or you get out, how can you feel, ma'am? You should be able to put yourself in the shoes of the people who are suffering there, not because somebody's mistake they have given that one. It cannot be taken as a reason for justifying all this heinous action and crime. So I just wanted to make it clear to everybody, including the eminent speaker who just said that makes surrender and all this thing. Let's get out. Please get out of the Gaza. Please leave them under their own rule. Then it will be easier for everyone to live in peace. Thank you very much.
Thank you.
Good evening, Mayor, Council. Dan Krasinski, Chief East Franklin Volunteer Fire Department. My address is 638 Nassau Street, North Brunswick, New Jersey. I've been the fire chief in East Franklin for 24 years. I've been brought before this council with given 2 proclamations. My fire department is very well recognized, not only in town, but through the state and other places that I travel to teach other fire departments about recruitment and retention, how to get members and how to keep them. Currently, East Franklin has 65 active firefighters, which is probably the most in any fire company in the state of New Jersey. With that being said, over the past couple months, we've had some contract issues with the Board of Fire Commissioners. And going back and forth with some news reports and some bad information was passed along and some contacts from people from the Democratic Committee sending me text messages and other committees saying, well, there's 2 sides to every story. So one of the things I want to bring to light is one of the things that is a policy that the board just recently passed, that they changed the last hour of drinking from 8 hours to 4 hours. So if you had a beer at midnight, you weren't allowed to get on a fire truck till 8 a.m. The Board of Fire Commissioners changed that to 4 hours. In 2006, we had a line of duty death in Franklin Township where that individual was given a federal claim by the federal government. He did not have alcohol in him. Everything was okay with that. His family got the money. By them changing that policy, God forbid there's another line of duty death, 4 hours is no good. So you could see why we as the firefighters at East Franklin are upset with some of these policies. New Jersey State Title 40A says the Board of Fire Commissioners' job and function is to provide fire apparatus equipment and manage the fire district. They have no say on the fire scene. They can't tell me where to park a fire truck. They can't tell me what to do at a fire. 3 of the 5 policies they tried to pass had to do with me operating on a fire scene. That's one of the reasons we didn't sign the contract. The other reason we didn't sign the contract, and I see people, talking on the street about cameras and fire trucks and chief's cars and that, and this, that, and the other thing. We've had cameras in the fire trucks for the last 15 years with no policy, with a sticker on the dashboard and a sticker in the back of the truck that says you are being recorded. We're okay with that because everybody knows that. What they just tried to do now is put a camera facing forward, a camera facing backwards, and at any point in time, a fire commissioner can turn on their phone and zoom into your car without you knowing it and hear your conversation, whether I'm talking to the mayor of Franklin, I'm talking to the mayor of North Brunswick, I'm talking to my doctor, whatever it is, without any notice. We got in touch with an attorney, we hired an attorney. She put a stop to that because it's a New Jersey law of wiretapping. There's a one-on-one. I know I'm being recorded. I don't have to tell the person that's sitting next to me they're being recorded. But if a third party zooms in on my camera in my car, it's a third party. So not everybody knows they're being recorded, which is against the law. That's why we didn't sign the policy. The other reason we didn't sign the contract is that for years, for 20 years I've been there, it was in the contract that the chiefs and the commissioners sat down, they came up with policies and procedures, and when you got to the head, you agreed or disagreed, you went back to the drawing table, and you fixed it, and we moved on. They removed that from our contract. So it says if the fire chief doesn't like the policy or procedure they put in place, they have 30 days after it's adopted by the board to send a letter opposing it. That's putting the cart before the horse, and realistically, when they're trying to pass policies about being on a fire scene, how can you sign the contract? They have no jurisdiction on the fire scene. Their attorney resigned. We've been trying to meet with them for 2.5 months. We offered an olive branch to meet with them. I sent a text to one of the commissioners yesterday. They don't want to meet with us. Now that they don't have an attorney, and they gave us a 60-day grant on time before they hire an attorney, our time is going to be expired. And then what do we do again? Guess I'm done.
Thank you, Chief.
Okay. So you have my emails. Anybody wants to contact me directly, please. Thank you.
Thank you, Chief.
Good evening. At this point, I'm not new to this Township Council meeting. My name is Aisha Ali at 20 Super Court. I know I may appear to be redundant, but I cannot satisfy my conscience by any other way, so I'm just going to ask again, even though I understood the statement you made at the beginning for asking for a ceasefire resolution. I realize that the previous responses are indicating it's not in our lane, but we had a glimmer of hope when it was suggested that the council response could be in support of our President Biden, who has called for a ceasefire. With hearing about children losing limbs each day that this war progresses, I feel compelled to continue speaking, and it compels me to come each meeting to know that the stories and experiences of these children and other innocent people are not getting lost in the rhythm of our daily life. This horror continues and gets worse each day as it continues, and the humanitarian crisis is so incredibly terrible that even news outlets are not covering it fully. But that does not mean it's not happening. So, and if this, so that's the reason I just make a statement, because I just don't want it to just get washed away. But if the ceasefire resolution is still seen as not relative to this council's office, I supplement with another request. Because Franklin Township is so diverse and comprises of citizens that are impacted deeply by this conflict, we ask the township to keep talking about Palestine, not just for its Palestinian residents, but by all those residents who are hurting by what they know is happening to others right in front of the world's eyes. With each passing day of this war, Palestinians and their culture is being wiped out in Gaza. Churches, schools, museums, and so forth are demolished or destroyed. The people of Palestine are dying each day. But their stories should not. We want to make Franklin Township a Palestine-friendly town. We want to be able to talk freely about our culture, our strive for freedom, peace, and right to exist without intimidation or harassment or indication that we're acting divisive. So going back to your peace resolution, and also we talked about some other approaches that we can take, such as an interfaith vigil, a town hall meeting. You know, these are good steps that we can take in that direction, so that we can talk about our feelings and our hurt, and also to keep the story alive. Let's normalize discussions and references to Palestine. Let's advocate for literature in our township libraries that talk about Palestinian history, its culture, and its people. Let's carry out our interfaith vigil, our town hall, where we can address our feelings and why we feel pain. Let's celebrate Palestinian culture through classes on embroidery, cooking, and art that represent the traditions and contributions of this culture and how it's added to the diaspora of Franklin Township. Let's include in our Franklin Township events like Franklin Day, where others can see and learn about these people and their struggle for a voice. There are Palestinians here, and it is part of our Franklin Township heritage, so it should be okay to speak about them in other ways besides the war. Let's introduce a resolution that protects our rights to speak, voice our concerns, and iterate the story of Palestine. Together with the councils and the town support, let's weave in all the different traditions of our backgrounds, all our personal narratives into Franklin that represents each one of us. And I think that should be in line with what you're advocating for. As you can see, the purpose of a peace resolution, the purpose of this interfaith vigil and this town hall is to achieve that goal where people of all different ethnic backgrounds can be free to express themselves and live freely without having to be scared or intimidated. So I hope we can take steps toward that, if not a ceasefire resolution, but at least these steps that can help tell the story of Palestine. Thank you.
Thank you. Anyone else?
I'm Arnold Litsky. I reside at 13 Dalton Drive in Somerset. And this is my first attention to your council meeting. But I was attracted by the overwhelming concern that I detect in the community regarding the matter of Gaza and Israel. And indeed, there is a war going there, and to restate the obvious and often stated comment that I know of, I don't have any more inside information than most people. If the hostages, those who are alive and dead in the hands of Hamas, were to be returned today, the war would be over. There would be no need to ask you or anyone else for a ceasefire. The Israelis have been pretty clear. They want hostages, and they will stop. I had the pest inspector come to my house today. He's going after a mouse. First time I've seen him in all the time I've lived there. But what happens? If I want to get rid of that mouse, I will have to put up traps to prevent any other mice from coming in. And I will go after all those who dare to come in. And I think that there's a history, as one gentleman has pointed out, of one-sided harassment of the other side. That is to say, there were bombs and missiles being thrown from Gaza into southern Israel for years, typically with few responses. But when the response has occurred, everybody wants to stop and have a ceasefire. You bring the heinous criminals in, and now you're punishing them, their relatives, and all the unfortunate children. That is beyond regrettable. That is a horrible thing to happen to innocent Palestinians or to any other peoples. But you have to consider who has started this and what are you asking. The October event was beyond humanity. It was horrendous. The only comparable events I know of are perhaps in Africa, perhaps in Germany and Europe. It was beyond comprehension. Now, the reaction is terrible and severe, but the numbers are nothing. You had 1,200 people in New York Times today who dying from heat in the Hajj in Saudi Arabia. War is awful. War is terrible. Nobody wants war unless they are hate mongers with no other value in life but to destroy another people, to destroy a stable people. I want to remind this gentleman, whoever else has spoken, there are many Arab and Muslim members of the elite in Israel. People are able to rise. There is not the hatred and prejudice for people who retain civil attitudes and humane decency towards other human beings. I'm all in favor of peace. I'm all in favor of ending war. I'm all in favor of understanding that there's a simple step now to put an end to it. Turn the hostages over, and I'm willing to bet the Israelis will not bomb again. Thank you.
Thank you. Anyone else wishing to?
This
No,
is
she
my
hasn't
first
been up.
time here. I
She
haven't
hasn't been
spoken
up.
yet. All right. I know, but it was about a month ago, so I'm not. Good evening, Council and Mayor. My name is Samina Sattar. I live at 18 Barbary Court, Franklin Township. I wanted to respond to some of what I've heard here today first, and then I'll get to what I wanted to comment on. I think it's unfortunate that people only see what they want to see. You know, someone mentioned that what happened on October 7th was the worst that has ever happened. But I think, it seems like then they don't care about the massacres that occurred in Deir Yassin, the massacres that occurred in Gaza and other parts of Palestine for many years. And to say that, Israel doesn't sort of respond to things, I think is just deluding ourselves. If you actually look at the facts, and, any human rights organization around the world will tell you the facts, and they're very clear, that it's very one-sided, and we're funding all of it with our tax dollars. I often come here just to update you on the crisis in Gaza because we've been, asking for a ceasefire resolution for some time. Just today, Israeli airstrikes killed 24 people, hitting 2 schools, hitting evacuation centers, hitting tents for displaced people. Israeli soldiers have killed Palestinians in the West Bank, not even in Gaza. And 500,000 people are at risk of famine, according to the UN Human Rights Organization. Children are dying in their parents' arms from hunger because humanitarian aid is not allowed into Gaza. And I say this because right now, I and others have been speaking up about what's happening over there in, this forum and other forums. But there are now 2 bills in the New Jersey Senate that would define anti-Semitism to include the things that we've been saying, to include and criminalize how we've been trying to stand up against what the Israeli government is doing. And, to basically, make all criticism of Israel and Israeli policy conflate it with anti-Semitism. So I wanted to just ask the council if they would consider passing a resolution that defines anti-Semitism in a way that doesn't stifle dissent and, will allow us to have these conversations because, as it would seem, currently the trend is to stifle any Palestinian support and, as it seems, to pass bills that would criminalize pro-Palestinian speech. Thank you.
I'm sorry, I didn't understand when you said stifle defense.
Dissent.
Dissent. Oh. Anyone else?
Seeing no one else come forward, Mayor, a motion to close the public portion of the meeting.
A motion to close public portion.
Moved. Second.
Moved and seconded. All in favor, say aye.
Aye.
Opposed, say nay. Motion is carried. Public session is closed. Let me address a few things. First of all, thank you, Dr. Karazi. My heart and brain is with you. I think that was very well said. As far as the complaint from Mrs. Saba that someone was living next to somebody with a megaphone, etc., Mr. Vornlacher can do his usual speech of you have to call the police. You have to call the police. I can't make things just go away. Our police sometimes can. So I'm not blaming the person. I feel bad for what she has to do, but you have to call the police. As far as the sign on Mont, it's his right, but that doesn't make it right. But it's his First Amendment right, even that word. First, the Supreme Court has said you cannot have vulgarity, but by that they mean pornography. So I don't want to give it too much oxygen. If you want to call me, I can tell you more details, but I don't want to give that more oxygen.
And Mr. Mayor, I'll address the flag comment. Ma'am, you've had your opportunity. There's no other opportunity to speak. Ma'am, I am using the microphone, and I'm telling you that you need to remain silent now while council addresses the comments. Thank you.
Okay,
Ma'am?
I will use the microphone.
I will also address the flag because I think there is certainly a great deal of misunderstanding regarding the flag that's flying at the corner of New Brunswick and Cedar Grove Lane. And I will inform this audience exactly what that flag is and the family who's flying it.
Okay.
If you'd like me to do it now, I will do it now.
No, Actually, let me finish,
Sure.
and then you can
Absolutely.
do all the things you need to do. Did you want to address the green resolution?
Yeah, I think what you were referring to was the energy aggregation. Yeah, so the way that the Board of Public Utilities works is on a 3-year rolling average for energy prices. And with the war in Ukraine, which has skyrocketed fossil fuel prices like oil and gas, which are a major component of how we get our energy, they have just kicked in on the rolling average. Those prices have started to come down, so the rolling average now is higher, but may not be, according to our energy expert, high enough for us to be competitive, because according to what was passed by the public, it needed to be 10% cleaner, so, wind or solar, and 5% less expensive for us to go forward with it. So she's recommended that in the end of this summer, that we put together the specs to go out in the fall. So that's kind of the new plan based on market conditions. So that's where we are. But I can think around the corner, we'd hoped to do it 2 months ago, but the market wasn't ready. And they're waiting to see basically how the other auctions go this summer, some of the folks that are in the hopper. We're just looking for the same type of energy. Yeah.
It troubles me, thank you. It troubles me that people don't feel they can speak freely. I guess we had an example of it tonight. We had people from 2 different viewpoints speaking, and it remained civil, so I appreciate that. Okay, I'm going to move on to the fire department. I've spoken to the chief several times. Council has no authority here. We don't control the fire departments. We collect their taxes, but it's not up to us whether we give them to the district or not. And then the district, I won't go into the whole economics of the fire system, but we have no authority over the fire departments. I have, however, talked to every commissioner in town, starting with the statement that I have no authority, but I am the mayor, and so I certainly have an interest. I've spoken with the chief, as I've said, and I've spoken with the governor's office about it, so I'm keeping them informed about it. I've also said I will not take a side on it, and so I won't. But I am aware of it. The manager is aware of it. Any council member who wants more information, I'm happy to speak to them. But we are keeping an eye on it, and what I want most of all is that that they come to a resolution so that they sign a contract. I think that's all I'll comment on right now. Mr. Manager, do you have more?
I wanted to address Ms. Saba's comments about someone making a comment about the flag that flies on the business at the corner of New Brunswick and Cedar Grove, and that it has some nefarious meaning. The flag is referred to as the Christian flag. It is, in fact, I'll read, it is the flag that was adopted by the United States Federal Council of Churches in 1942. It's being flown on a flagpole on the business owned by a family that I believe it is the longest running commercial business here in Franklin Township. They are very much a God-loving family, very active in their church, and I don't think that it has could even possibly mean anything in any negative way other than their love of God. It is literally called the Christian flag, and it was adopted by the Federation of Churches in the 1940s. So I don't know who is spreading rumors about this family and the flag that they have on their flagpole, but I would ask that they stop. I've known this family for my entire time working here in Franklin Township, and I can give you every assurance that they're nothing but very much church-involved, peace-loving, and community-minded family. So I think you should tell whoever told you that that's what that flag is. Other than that, anything else will be in my report.
Okay, any council members? Okay.
Mr. Mayor, Ms. Saba asked about the size of the sign, and I think it's worthwhile for you to know that.
4 feet by 8 feet, and the measurement of the sign has already been determined to be less than what is the mandatory maximum sign permitted in Franklin Township for a political sign. Ma'am, I can't, I'm telling you that everything about this sign has been determined to be legal, not only by our police department, zoning department, but also by the township attorney. That's why, ma'am,
Ms. Saba, you can't. No, Ms. Saba, you can't. Believe me, when that sign went up, we paid attention, and we did what we could do. Okay, time for council comments. Councilman Karazi.
Thank you, Mr. Mayor. Just a couple of things. First of all, I attended the Juneteenth celebration. It was a great event, and the other one was the high school graduation. So congratulations for all the high school graduates, especially our Councilwoman Udin's daughter, and congratulations on that. The HRC meeting is coming up tomorrow, and there will be some discussion on homeschooling and New Jersey National Guard, and Ms. Peterson is going to be talking about it. And also, we will be appointing a new junior commissioner due to graduation. Mayor, those are the two items that I have.
Thank you very much. Councilman Onijaka.
Yeah, Mayor, I don't have much to say. Let me use this. Okay, for thanking Dr. Karazi for boldly repeating our stand. I'm very happy for what he said, and it's what we stand for. Thank you.
Thank you. Councilman Embarrasson, I almost called you Doc. I think of you as...
I got two in my house.
Okay.
Thank you, Mayor. So last couple of weeks, we did a number of things. We had a planning board meeting. There was a development that was approved on Hamilton Street with a huge support from the local community. So that was see. Oftentimes we hear people come in opposition to projects. There was also an interesting presentation by the Somerset County Engineering Department on the Eastern Avenue corridor project. That's a traffic study. That's a multi-year project. That's one of the first meetings that they presented. Pretty much the data on the traffic study. That data is on the website by the county. I encourage you to take a look at it, and they welcome any feedback from the citizens in terms of providing some ideas or issues that they're facing. So they're going to come up with some solutions to relieve traffic, and if the Federal Department of Transportation approves those ideas, then they will fund it, and it'll take a few more years for the project to be complete. Hopefully that would relieve the traffic congestion to a certain extent. They're not going to be able to solve it, but hopefully we'll get some relief. I also attended the Juneteenth parade. It's a great event, as usual, every year. We have been going there for a number of years now. Good speakers, a lot of organizations set up tents, and we had a good time. Also the graduation, it was fantastic. Do you know 578 high school students graduated this year? It was fantastic. In fact, it was very hot in the afternoon, so it was moved from 3 o'clock to 5:30 in the evening, so it was a wonderful event. Congrats to the daughter of Councilwoman Udin. She's going to Rutgers and in New Brunswick. It was a great occasion to see them together. took a picture for them. Other than that, I met with the good folks from of YMCA, the Y, otherwise called, and they are putting together a fundraising team, and I agreed to serve on the steering committee for the fundraising activities that's going to be happening in the next few years. It's a welcome addition to the township, and they're also focusing on our neighboring towns in terms of raising funds. More details would follow shortly. Other than that, we welcome another cannabis shop in the Kingston area of town called City Roots. It's the place where Genova was before. It's hidden from the main street, so you cannot really see it. It's a small boutique shop. Assemblyman Danielson tells us that that's the kind of shop that they envisioned at the state level when they passed the law and promote local businesses, family-owned businesses as opposed to huge corporations coming in and setting up shops. That's all I have, Mayor. Thank you.
Thank you. Councilwoman Francois.
Yeah, I would just like to thank our Dr. Karazi, our councilman, esteemed councilman Karazi, Alex Karazi, for the work that you've done even before you became a member on this council, and the work you continue to do and the partnerships that you've continued to evolve and explore and maintain with the Interfaith Council. I think your leadership here on this board is exemplary, and I do appreciate all the work that you're doing in the community. And, you know, a lot of times when people become on city council, things that they used to do before they became a politician, they push to the wayside. But I think it's really, really important that he maintain the level of excellence that he's had before even becoming a politician, and maintain that relationship and embody what you've been doing in the Interfaith Council. So I just want to thank you for your leadership and work that you're doing in our community to bring about peace. Thank you very much. That's all I have, Mr. Mayor.
Thank you. Councilman Wright.
Our esteemed clerk was like, why didn't you start over here like you always do? You know, so it took her off guard. Okay.
Gotta mix it up.
He apologized. A couple of things, and I think...
No, I didn't.
Loving you. A couple of things right quick, and that township manager would be the one to answer this question. I didn't, but I'm more sure he got a headache on this one. There's a sign on DeMont Lane. They had an issue with the wording on it for Mr. Biden. And the email came to me.
I think that's what we all just addressed earlier, Council.
Yeah, I'm just letting you know that it came to me, and I don't know if it came to everybody else, but...
I've gotten many on it.
We've all gotten complaints.
We've gotten probably about 100 of them.
Yes,
okay.
all the time.
Yeah,
And when I
okay.
get
And that's
one,
what I just addressed in the mayor just.
Whenever I get one, I call the person.
All right. I didn't know. So, Bob, that's why you get paid $1 million, I tell you.
No, that's why your township attorney gets paid $1 million. I get paid $10.
My second thing, we just had Juneteenth, Franklin Township, a week ago. And I want to say, outstanding event as usual. And I love my fraternity, Omega Psi Phi fraternity, because along with the other Black Greek-led organizations, we had a float, and outstanding. I just want to say it was outstanding, and the vendors that we have, and more importantly, the sounds of freedom. And when I say the sounds of freedom, the performers were there. And if you paid attention to some of them, well, all of them, they gave you a little snippet, a little nugget for you to chew on that told you this is what we are, this is what happened, and this is where we're going. to that event, I like that. Next year, I hope to have a bigger one. And again, everyone's invited, no matter color, shape, size, form. Everyone can attend because we all know what it's like to be put under the thumb of another majority or minority. So we need to express our gratitude, not just for us, but for everyone. So it's an every person parade. Do come out for it. Recreation Advisory Committee, summer concert, June 28th from 6 to 8 p.m. at the Township Gazebo. I know we're going to love this. It's called Total Soul. And from what I understand, I haven't seen them, but everyone else has, that it's guaranteed to be a barn burner. Ain't that right, Ms. Francois? Have you seen them?
No, I haven't.
You haven't seen them? Because I've gotten all these emails saying that this is going to be the crew that knock out. So I plan on being there for this event. And also, we have VIP parking pass. Don't you just love it? And this is for our Franklin Township fireworks on Wednesday the 3rd, 2024. So all of you come out to our fireworks. Now, there are a lot of townships that don't have fireworks. We do. And people from other townships come out and hang with us. So I'd advise all you Franklinites, if you want to get a good parking spot, come early. That way you get your spot and indeed have a good time with us, because we will have a good time. All of my fellow council members will be there. I don't know if they'll be wearing bells and whistles, but they'll be there. And that, I think, yeah, that's it. Thank you, Mr. Mayor.
Thank you. Councilwoman Udine.
Thank you. Let's see. So, Councilman Dr. Karazi, thank you for your words. A lot of folks that may not know Dr. Karazi, Councilman, has very strong ties with our community, so appreciate all the relationships that he brings in and the skills. I think it helps us. We're all very diverse in our career paths and just our skills. So it's so nice to have Councilman Karazi provide his inputs and be with our team. So thank you again for your words. Franklin High School graduated. I attended a couple graduations last week. CJCP had graduation ceremony and Franklin High School. So thank you to my peers, Councilman Anbarasan and Dr. Karazi, Councilman Karazi, who got me videotaping, and Sami Shaban, who got some pictures, very close-up professional pictures of me and my daughters. Thank you again. I think when you have peers like that, like who needs the paparazzi, right? They're amazing. So thank you again. And congratulations to all the seniors that graduated. Juneteenth, I missed the event because I have a very young adult who is going to Rutgers, so I had to attend a couple of sessions of the tour of Rutgers University that day, so I heard the event was amazing, but I couldn't make it. We'll be there next year. We do have, when you mentioned Friday, June 28th, there's the summer concert. So with that, June 29th, we have the Eid celebration, the annual Eid celebration, which is our second year doing it this year. That's happening in the Hamilton Street campus. We had it originally at Samson G, but because of the overwhelming positive response from the community, we have over 500 guests that have reserved. So we are excited to see everyone on Saturday, June 29th. Starts at 5 p.m. We have Kawali musical night that's happening. So we have a band that's coming in with 7 members with their whole sound system. So it's going to be a very fun-filled evening. And then we have balloon artists and face paint for the kids from 5:30 to 7:30 p.m. So it's a family event. Everyone is welcome to join. Please do be there, because I think we have also many elected officials coming in from various of our surrounding cities and towns. And I think that wraps it up. Thank you very much.
Thank you. Councilman Vasanella.
I want to, I know they all left, but congratulate, I know it's the chaplains that were here, and applaud our safety director's efforts that I was not as aware of the wonderful results until this evening of expanding what probably is more important now than ever in the field of law enforcement, and that is to have some resources to deal with the many things that they deal with, which are, I don't know how they do it, quite frankly. But congratulations to those chaplains and to our public safety director for enhancing that program. I'll be a little less formal. Alex, which is how I met the man several years ago. Enough was said about your work with the Interfaith Committee, so I don't want to be repetitive. I do think of things when I'm hearing are these council comments, and no one has to jump in now, but I'm actually wondering, we have so many liaisons, I don't know if we technically have a liaison to our Interfaith Committee. So not to get into that now, but understandably, and I'll move into my main, what I was saying, you have to readjust when you get on council, whatever, especially if you're involved the way Alex, my friend Alex, has been in the community, or if you've been here like myself for many, many decades, or whatever the reason is. You could be new to the town, but you need to, I'm going to say sometimes a difficult transition, because there's a lot of things I say can't do, but need to approach much differently than you're used to as and I don't mean you, only Mr. Karazi tonight, any of us, I'm sure, went through a transition period, but usually you're not dealing with something quite as sensitive and delicate and upsetting as the issue we've been dealing with. But I want to also expand on that. Before I got on council, the first township committee I ever served on was the health board, and a health advisor. And although we had a fantastic, and I know Bob knows many of the people served on it back then, most of them are gone now. As much as it was a great advisory board, I'm glad to see that it's going wonderful places, and that you're our liaison there. Moving along real quick, civics, somebody mentioned civics. I don't think there's, other than health and safety and maybe keeping our infrastructure intact, to encourage and open opportunities for people to engage in civics is so important, whether it's to a grammar school aged child or a senior citizen that is looking to put their time to use in their community. So we do a lot. We're open to doing more in a general sense of engaging people in civics. You're welcome to bring your idea to me or any council person you're comfortable with. 4th of July is coming up. I think I heard it mentioned. Our 4th is our 3rd. The 3rd is to become the new 4th for Franklin. I think the last couple years we had that as our date. This year it's the 3rd, if my information Deputy Mayor just slipped out is correct. Hopefully we won't get weathered out like we did with our Memorial Day. Seems like every year something gets, Franklin, this one of our great celebrations gets canceled or changed because of the weather, but let's hope that that stays intact, especially since Memorial Day parade did not happen, unfortunately. We did not have a Public Safety Committee meeting tonight because we had the Health Advisory Board, and we usually have that prior to our meeting. I'm not going to get into the details. Concerning Easton Avenue, Councilman Rahm explained general of the larger projects. Many of you may know I had a town hall meeting a month ago, a little over a month ago now, that got into some shorter term initiatives, and I'm not going to go into detail tonight because I wanted to get some information confirm some information with our manager who's been helpful in this process and our public safety director, but we're doing some local initiatives. I say we, the county and the town, with helping Easton Avenue become a safer, better maintained corridor. So probably in the next meeting or two, get into a little bit more detailed update on what I think are good things. I have the mantra, I want more, and I'll keep repeating that probably as long as I live in this township, but I'm pleased that some of these short-term initiatives are starting to move forward. I apologize. I don't want to repeat other things that were mentioned by other council people if I could avoid it, and I think that's all I have for today, Mayor. Thank you.
Thank you. Deputy Mayor Pataz.
I want to extend appreciation to Dr. Krause, Councilman. We ran for school board many years ago. I can't even remember the year. I'm trying to think back. I'm just going to leave it at that. And also Councilman Udine for their tremendous, I would say, courage and the challenges along with with the mayor. As we've talked through the resolution. I also want to give a shout out to Councilman Udine because of the tremendous satisfaction it is to have a child graduate. And I think back to my education days and when I was on the school board, all the trials and tribulations throughout a year and, watching graduates go across that stage and the joy in their eyes and in their families' eyes is just tremendous. So a lot of love to you and happy graduation to everybody. Special appreciation to the parents, those who were parents by birth, those who became parents by vicinity, as well as the teachers and the administrators and the whole community, because it does take a whole community to raise a child to be successful. And that's all I have. Thank you.
Thank you. Think I have anything? Your manager.
Well, I would like to thank Councilman Wright and Councilman Vasanella and who for giving my report tonight. Good job. You covered everything that I needed to cover already. Fireworks and concerts and all of the like. There is one that you all missed, and now we were talking about it. Councilwoman Udine asked me about it earlier before the meeting. The planning board's business and industry sponsored master plan study is having a public meeting, a community meeting, to meet with the consultant that the planning board engaged, Brightview Engineering, to do both the traffic study as well as the planning study. So it is this Thursday, the 27th at 7 p.m. right here in this room for anyone who is interested in that. I'm surprised that no one has asked me, but I will give you the report that I received this week from Dr. Ravalli on the construction trade program that the Township Council chose to fund with American Rescue Plan funds. It begins on July 1st. Most of the materials necessary to run the class have been received or are anticipated to be received next week. And there are 24 students enrolled, all seniors, and they all are slated to begin on the 1st of July with a mix of students from the regular track as well as RTS. So that is on track to begin on July 1st. And I think that might be it.
Thank you. There are no council discussion items. Approval of the minutes. I present the following minutes to the Township Council for their approval. Township Council work session, regular meeting, and executive session on May 28th, 2024. We have a motion on the minutes.
So moved.
Seconded.
Moved in, seconded. All in favor, say aye.
Aye.
Opposed, say nay. Motion carried. Do we have to vote on the minutes?
Councilman Embarrasson?
Yes.
Councilwoman Francois?
Yes, even though I wasn't here.
Councilman Karazi?
Good job.
Councilman Karazi?
Yes.
Mayor Kramer?
Yes.
Councilman Onijaka?
Yes.
Deputy Mayor Pataznik?
Yes.
Councilwoman Udine?
Yes.
Councilman Vasanella?
Yes.
Councilman Wright?
Approval of the warrants. Time to pay the bills in the amount of $2,180,753.02 on June 25th, 2024 are presented to Township Council for payment. Do we have a motion on the warrants?
So moved.
Seconded.
Moved in second. Any discussion? Anyone would like to pull an item? Madam Clerk.
Councilman Barrison?
Yes.
Councilwoman Francois?
Yes.
Councilman Karazi?
Yes.
Mayor Kramer?
Yes.
Councilman Oni Chaka?
Yes.
Deputy Mayor Potasnik?
Yes.
Councilwoman Udine?
Yes.
Councilman Vasanella?
Yes.
Councilman Wright?
Time for ordinances on second reading. This is where we vote on the ordinance. Ordinance 4724, an ordinance amending the municipal code of the Township of Franklin, County of Somerset, State of New Jersey, more particularly Chapter 183, Property Maintenance, by adding new Article 8, privately owned salt storage is presented for the Township public hearing, and final adoption. The public hearing has been noticed as required. Do we have a motion to open public hearing?
So moved.
Second.
Moved and seconded. All in favor, say aye.
Aye.
Opposed, say nay. We are open to the public on this item only.
Seeing no one looking to speak on this item, Mayor, a motion to close the public hearing on the ordinance.
Second.
Moved and seconded. All in favor, say aye.
Aye.
Opposed, say nay. Motion is carried. Do we have a motion on the item?
So moved.
Second.
Moved and seconded. Any discussion on it? This is, people have to contain the salt that they have for salting roads if they own it privately, so that it doesn't get into our stormwater. Any other discussion? Clerk.
Councilman Barrison?
Yes.
Councilwoman Francois?
Yes.
Councilman Karazi?
Yes.
Mayor Kramer?
Yes.
Councilman Oni Chaka?
Yes.
Deputy Mayor Potasnik?
Yes.
Councilwoman Udine?
Yes.
Councilman Vasanella?
Yes.
Councilman Wright?
Excuse me, Ms. Ali, if I could put upon you to wait until the meeting is over. I would, pardon?
You're getting called to the
You're not in
principal's
trouble. Thank you. Or,
13.
13, ordinance on introduction and first reading. This is when we introduce to the public that we're going to consider an ordinance. 4438-24, an ordinance amending the code of the Township, Franklin County of Somerset, State of New Jersey, more particularly Police Department, Section 50-5, Division and Bureaus. The foregoing ordinance is presented to Township Council for adoption, first reading and posting and publication in accordance with law, public hearing and final adoption at a meeting of the Township Council to be held on Tuesday, July 9th, 2024, at 7 p.m. in the council chambers. Do we have a motion to introduce?
So moved.
Second.
Seconded. This is a change to an ordinance of 3 words, renaming divisions and bureaus. Do we have any other discussion? Madam Clerk.
Councilman Barrison?
Yes.
Councilwoman Francois?
Yes.
Councilman Karazi?
Yes.
Mayor Kramer?
Yes.
Councilman Oni Chaka?
Yes.
Deputy Mayor Potasnik?
Yes.
Councilwoman Udine?
Yes.
Councilman Vasanella?
Yes.
Councilman Wright?
Ordinance 4448-24, ordinance amending the municipal code of the Township of Franklin County of Somerset, State of New Jersey, more particularly Chapter 226, Vehicles and Traffic, Section 226-17, Vehicles over designated weight exceeding, excluded from certain streets, that's Cedar Avenue and Griggs Street. The following ordinance is presented to the Township Council for adoption, first reading, posting, and publication in accordance with law, public hearing and final adoption at a meeting of the Township Council held on Tuesday, July 9th, 2024, at 7 p.m. in the Township. Motion to introduce.
So moved.
Second.
Moved and seconded. Discussion? This is as limiting Cedar Avenue and Griggs Street to 4 tons. No other discussion? Madam Clerk.
Councilman Barrison?
Yes.
Councilwoman Francois?
Yes.
Councilman Karazi?
Yes.
Mayor Kramer?
Yes.
Councilman Oni Chaka?
Yes.
Deputy Mayor Potasnik?
Yes.
Councilwoman Udine?
Yes.
Councilman Vasanella?
Yes.
Councilman Wright?
Consent agenda. Items A through O as listed in the consent agenda portion of this meeting are presented to Township Council for adoption. To have a motion on the consent agenda?
So moved. Second.
Moved and seconded. Does anyone like to pull an item or bring out an item?
Yes, Mr. Mayor.
Yes. I think your mic is on.
You're not, I can't hear you, Councilman. Go ahead.
I'm sorry?
I couldn't hear you.
Oh, number I and number N, if you can please, since he's not here to hear the reply to this.
That's okay.
They ask for information on these things, but never stays to hear them, but I think all of our other members would love to hear about it. And number D, sidewalks. I mean, sidewalks has been a thing that we've done for a very long time.
Well, I'll answer letter I, and letter D, and letter N. I don't know any numbers like that.
Oh, well, you know what I mean. Help a brother out.
I'll start with I. I is the insertion into the calendar year municipal 2024 municipal budget, a grant that is received annually to provide meals to those children in our summer camp program. So, and D is authorizing a change order on sidewalks that were installed because it came in slightly at a different number than what was budgeted. I believe that it came in slightly over budget by
About 8,000.
About 8,000. I would say under 10, which is well within the 10% margin permitted on change orders. And what was the N was the other one? I have it on the computer, Alex, that's why I'm.
Water main replacement.
Authorize the execution of grant agreement, Franklin Town. This one's kind of funny. This is where the federal government often doesn't make much sense. So the Township of Franklin received American Rescue Plan funds, and we are utilizing a portion of those American Rescue Plan funds to install replacement water mains in our town that are under the control of the township's water utility. And the federal government says that you, the township council, have to authorize the granting of the money to your own water utility. Now, I'm not quite sure why they are saying that we have to do that, but that's what we've been told we have to do. So that's what that is for. That is to expend American Rescue Plan funds on water main replacements here in Franklin Township under the control of our water utility.
Now, just one more piece of that, since we, getting through that. How many more water main pipes, is that going to be a continuing thing that we're just going to keep doing?
You will continue to replace water mains until long beyond all of us are here.
So is that a set amount that every
So yes, the anticipation is that the useful life of a water main in its current form, the new type of materials used in water mains, is about 100 years. In past iterations, it was 50 years. So you generally would replace pipes at a rate, that falls in line with that useful life of the pipe, based on the amount of pipe that you have. So it's anticipated that we will continue to replace water mains within our water system forever. It's just only a small portion of it every year.
Now, another question, and I've been looking at this, and I guess we've been going around and around, because we were looking to do some replacement over there in Councilman Vassinella's neighborhood and mine.
Yes.
And when I look at
Ward, not neighborhood, I just want to be clear.
In your ward neighborhoods, but
looking at the Fourth Ward and doing some of our water main replacements, is that a special need area? Because I know.
There's a couple different factors involved here. One, that section in the Hamilton Street corridor is the oldest portion of our water system, some of it having been inherited from New Brunswick when we first created a water utility in 1958. But But the decision on where to use American Rescue Plan funds is also driven by the fact that the federal government had encouraged that rescue plan funds be utilized for this purpose, one, and in census tracts that exhibited the most need from a financial standpoint of its residents.
Thank you. That's what I was trying to bring up, because some people want to know, how does that work? Where do we replace them? Is that just a one-off? Somebody thinks about where we're going, and
the water mains are being replaced. I mean, they're in some cases all over town based on age and history of main breaks and things of that nature.
Mm-hmm.
But in particular, the rescue plan funds were focused on the 4th and 5th wards in that general vicinity of the Hamilton Street corridor, which also coincides with, like I said, the oldest portion of our water utility system.
Thank you very much.
So not to belabor the subject, I just had a technical question a manager or lawyer could probably answer. I couldn't be happier than to see this on there. And Councilman Wright, I could tell you that this whole area has been slated actually several years ago. So I'm glad to see this is happening, because we all know what happens when you have water main breaks. So I had a question. Yes, Mayor. I'm sorry. I'm just happy to see this on here. I know it gets tricky with the federal grants, and I know from being involved with this at public work meetings that there's a possibility that we're not sure exactly what streets, although we know they're going to be in that area. I just want to make sure there's no technicality here that if we add or delete a street based on when they start to do the design elements and figure out what we can afford to do as much as we can, do we have to have any street that we possibly incorporate into these projects on here, or is there any technical? I know it gets very tricky with the federal funding. Like if we wanted to add a street because we can do these two but not this one here.
You can only do what we have funding for.
No, I mean
So
the way
it
they're
will be
listed.
fully expended, and it will then probably be supplemented with normal water utility budget money. It's not a question of adding streets. This money will be utilized to fund water main projects in that area that we've identified and I've just spoken about.
So I guess maybe I didn't word that right. If we find that we can add another street in need in that same neighborhood.
No, I think you're missing my point. It's not. It will not do all of the streets to begin with. So we won't be adding streets.
Gotcha.
You're going to be supplementing with municipal water utility.
Okay. Now I understand, Manager. In all the breakdowns in our PW meetings, so we didn't see per street because we hadn't got to that point. But what you're saying is we'll probably have to throw a little ratepayer or a little of our water funding in.
Not probably.
Okay.
You will.
Yeah, we will.
Yeah.
Okay, so I got you now. I understand. Thank you.
Yep.
And that's it, Mayor.
Thank you. Anyone else? I'd like to just mention item number M. The township is helping the school build Sioux Falls Health Clinic. The bids came in higher than expected, so we're kicking in half of the increase, and that's why this is on the agenda. But we're bringing healthcare to the masses. Anyone else? Madam Clerk.
Councilman Embarrasson?
Yes.
Councilwoman Francois?
Yes.
Councilman Karazi?
Yes.
Mayor Kramer?
Yes.
Councilman Onichaka?
Yes.
Deputy Mayor Potosnik?
Yes.
Councilwoman Udine?
Yes.
Councilman Vasanella?
Yes.
Councilman Wright?
Done, Rich.
There were no resolutions to be voted on separately. Old business, boards, committees, commissions, anyone have a nomination?
I do. Actually, a couple. Jessica Johnson was a full member of the Environmental Commission, resigned, and Anne Marie, I think they sent that over your way to the clerk's office. I want to nominate Robin Saddam, who is currently an alternate two to the regular member for Jessica Johnson's position that's ending December 31st, 2025. And then to fill the alternate two-member position, Ellen Vastola, Vastola, of 43 Norwick Place, also ending December 31st, 25.
Do we have any other nominations for those positions?
Mr. Mayor, there are two applications, one for a Senior Citizen Advisory Committee, and the other one for Advisory Recreation Council, which they have openings. Each one has one opening. So the first one is by Mr. Robert Akwai, if I'm pronouncing the last name correctly, and the other one is by Mr. Fahad Akhtar. So these positions are open and they have application.
Do we have any other nominations for those positions? So we can do these all by acclamation. Those in favor, say aye.
Aye.
Couldn't hear who you nominated.
Oh. The resumes, the applications are in the packet.
Yeah. The nomination, Councilwoman, is for Senior Citizen Advisory Committee, and that's Mr. Robert Akwai, and also for the Advisory Recreation Council is Mr. Fahad Akhtar.
Can I ask for a roll call on Fahad Akhtar?
Sure. So we'll do the other three by acclamation. All in favor, say aye. Aye. Opposed, say nay. Motion is carried. So we'll do roll call on Fahad Akhtar. Any discussion?
Well, I'm not sure if folks are familiar with him. Something else happened. I think we received an email from the individual, and I did some Googling, and I have some concerns, so I'm going to be a no vote.
You want a motion to table?
Maybe we could table it so folks could have another more time to consider. I move we table the nomination of first name, Fahad Akhtar.
Do we have a second?
Second.
So a motion and a second to table. The only thing that can be discussed is when to table it. Does anyone have any discussion? Table it to.
Deputy Mayor, did you have any suggestion?
Table
indefinitely.
Okay. Table indefinitely, okay. Madam Clerk?
Councilman Barrison?
Yes.
Councilwoman Francois?
Yes.
Councilman Karazi?
Yes.
Mayor Kramer?
Yes.
Councilman Onijaka?
Yes.
Deputy Mayor Potasnik?
Yes.
Councilwoman Udine?
Yes.
Councilman Vasanella?
Yes.
Councilman Wright?
Yes.
Any other boards, committees, commission vacancies? We have no executive session. We have a motion to adjourn.
So moved.
Seconded.
Moved and seconded. All in favor, say aye.
Aye.
Opposed, say nay.
And
Motion is carried. Be well, Franklin.